We'll also go forward in the instruments of social information, social registries, and all of the challenges of information towards social protection, and we'll close with financial sustainability. Our region has gone through very interesting experiences in expanding this protection. We have the mandatory affiliation of independent workers in Chile, for example. Something similar is seen in Peru. There's debts from Colombia. And we also have the experiences of taxation in countries such as Argentina, Uruguay, Colombia, and Brazil. We will be seeing this kind of topic today, always having in mind that the high levels of social protection that we aim at. We saw that 35% of the households with children and adolescents without elderly persons do not have access to social protection. So we know that there is a big chunk of the population that requires urgent inclusion into social protection. Thank you, Claudia. We will now then begin with the fifth panel, outstanding experiences of countries in the region. We have three outstanding speakers as well. The first one is Victor Hugo Montoya, head of the ONP Peru. We will also hear from Raciel Ramirez, Technical Coordination for Institutional Transformation from Social Security Institute, Mexico. And to my left, the third speaker, Pedro Alcantara, SDVS Director from Dominican Republic, CNSS. We will also have as discussant Helmut Schwarzer, who is following us online from Geneva. He is head of public finances and actuarial services from Social Protection Department, ILO. Thank you for being here with us. Each speaker will have 15 minutes for presentations. We have simultaneous interpretation into English and Spanish as well. You can get your earphones. We also have interpretations online, and we thank the more than 60 persons who are following us online, added to 50 participants here in this room. We'll also send you a link for evaluation that is so important for future events. I hand over immediately to Victor Hugo Montoya from ONP Peru. Thank you, Andres, and I thank ECLACA for the invitation to be here. It's a pleasure to be here and share our experiences in Peru on pension systems. We'll start by telling you about a real case, Marta. In 2020, she was 65 years old. That's the retirement age for Peru, but she only had contributed for 13 years. According to the rules during those days, then she had no access to pension. This is something that worried us and that triggered all of the measures that we started adopting to include this kind of person into the pension system. Let's talk about the National Pension System, SNP. This is the parallel system in Peru with two competing models. We have the public Social Security system that follows the 1990 from 1990, and that is pay-as-you-go system with a common fund. It's an open system, an AFP. There are contributors with a low average of about $52, but only 30% of the workers contribute. And this is important, by the way. They are mostly dependent workers, so they depend on their wage, where 13% will be discounted, and less than 2% are members on a voluntary base, and that may include informal or independent workers. Of and in that group, 650,000 persons do have a pension of about $150 approx, with a replacement uh, that is pretty much the average for the country. As you know, the main goals in our system have to do with coverage. We will talk about coverage to see how we can increase it. And we are working with two targets. How to do so amongst the affiliates, that is workers who contribute every month, and what about the other retired folks? Now, what are we doing to increase the coverage of the affiliates in the national pension system? Security, social security systems were thought of having in mind a model that does exist in our countries, where formality is only up to 30%. It would seem then that people work every day for a company that will have a contract, and after uh, retirement, the person will have a pension. But that's not what happens. People have a contract, and they become informal workers, and they go back to the system, and so on and so forth. So it was very difficult for a constant contribution from these workers. There were so many rules, so many restrictions, and this is a system, like most social security systems, that was very difficult to understand, very, very complex, with a lot of information for the workers, so many rules, what kind of contributions you want to make, do you want this kind of discount, what is the replacement rate, so a lot of complicated information for people who are the clients of the system. So we're working in this. We wanted to identify who are the persons who do not contribute to the uh, official system, and what's happening with independents and the informals. But there is a great diversity here. As Claudia said, not everybody is the same. The taxi driver who works in a platform, or the farmer in rural areas, or the delivery person, or the independent attorney who works on his own and who does not contribute either. So we have to identify these individuals, and in that we have to have strategies for each group. What is their culture? We have to promote the social security culture. Some people delay getting into this, but we have to promote this culture, telling people to start paying at the beginning. We also must pay attention to these groups. We know that there are many tools that are available, but not everybody has the technological maturity to follow this online. So do we communicate correctly? How do we reach these groups? How do we do so with a simple, understandable language? Sometimes we use a complicated language. People just don't pay attention. We must be kind. We must be emphatic. We must be clear. How to get procedures to be simple. Sometimes there is a lot of red tape involved, so we must break through all of these complexities in becoming members of the system. And besides, we should offer something aside from becoming affiliates. We must make this more attractive, flexible, and simple. And we're right now into this. We're trying to look at all of these steps. We have made progress, yes, but still much remains to be done. The first thing is to identify the target groups. We know who they are, but we have to quantify them and we have to know what they are like. In the world of workers, we know that there is the independent workers that sells out in the street. There are people who sell clothes, but they're all different because the person who sells food stuff works every year, but not the clothes seller. They sell according to marketing strategies. For example, they sell uniforms at the beginning of the year and at the New Year's or Christmas. So there are moments when he sells more. So we have to know about their MO. We have to know how they sell, and then we have to reach out to them, try to explain what we want, and then use innovation, trying to have a proposal that is attractive.
So today, we have controlled this group of people with important influence because we've identified a group of more than 20 sectors that could be of interest. Complicated groups in the informal farmers, fishermen, workers that sell things, or others that provide services. How to deal with general service people, carpenters, electricians, influencers. This is a new way of work. How does all this connect to migrants? There is major migration, and yesterday in the panels we were seeing this. How do we connect all this? That is our challenge, getting to know them, who they are, and working with them. So we've moved ahead in culture. We get people to explain from their viewpoint what the pension culture is about. And this is a video done by the citizens, not the ONP. It says Martina and her trainers. She is Martina, she's just 15. And her birthday, she got two cuyes. One a male and the other a female. Martina was very annoyed because she really wanted new trainers. But her grandmother told her that she would be better off with the cuyes, the guinea pigs. And so Martina took care of the guinea pigs for them to grow up. And then they reproduced and they had 4 babies. Martina also cared for the 4 babies and got them to grow up. And then she sold them and she got all this money. With half of the money, she bought trainers for the granddaughter, and the other she put away. So now Martina is fed up with the cuyes or the guinea pigs, and she wants to go to university. But she is selling half of them, and the rest is putting them away. She is working with dedication, learning to wait and save. And so you will have a better future. In addition to the culture, we must continue ahead doing more interactive things, games for children to follow up on all this. And at the moment, we have online or in-person channels. We would like also to have a bus that travels the country to provide services, fairs where we have the migrants and the workers and talk to them directly. So we've gained ground in terms of communication. We have bulletins or news sheets to explain things in simple words. And we need to have platforms where it's simple to understand the language and capture the message that we want to convey with a language much closer to people. As you can see there, 2 things that we did in strategy and direct contact in the metropolitan area outside the Lima underground. and bring the pension issue to them, not wait for them to approach us. Facilitating contributions. We're seeing how to have an in-person affiliation or technology, which will also must be done through different means. WhatsApp has worked very well, especially in Africa, as a mechanism for affiliation or membership. We want to create a club of members, a platform of services for independent workers, and say, in such and such a place, if I pay in for 6 months, you get such and such a service. And so that a formal worker is also paying in for an independent worker that they're responsible for. So this is a contribution unit. It used to be monthly, a fixed amount around 130 soles. So what did we do? This is a regulatory change that occurred several years back. We allowed a unit of contribution. It's not that the independent worker needs to pay 130 soles every month, but we're talking about a unit, so they can go pay 30 soles 1 month, 40 soles another, and another month, like so and so, for another 20. And in 3 months, they completed a unit of contribution. And why is that important and not do it in once as they did to do it before? Because sometimes these people do not have sufficient money. To many of us, would not seem much, but sometimes their uh, pace of life is different and they don't have the money. So we must adapt to that reality and see how to make these little payments easier, and they can add up month after month. And what but it's measured in units of contributions. And the important thing is that later on they have sufficient unit of contribution to be able to apply for a pension. So we're also creating a payment catwalk or e-payments or other mechanisms. For example, if they go to buy gasoline for the car, you say, I pay 80 soles of gasoline, I'm paying with 100 and the difference of 20 can go to my pension account. Well, this is a project that we're moving ahead with. Some things have already been set up, others are ongoing, but now we're thinking of extending the coverage of our pension system. These people that I told you about a moment before couldn't have a pension because we had only 13 years of contributions. Marta, was she unable to ask for a pension? Because we required 20 years paying contributions. But people today in Peru, even with 10 years contributions, 120 units of contribution, and at the moment, you have a right, she has a right to a pension. A limited pension, but a pension at the end of the day that would allow us to have a health insurance. And if the years of contributions were insufficient, the system today allows you to make a loan. So you have 19 years contribution, you want to get to 20, that amount is loaned. And and we calculate the pension as though you had the 20, and that year's contribution is discounted from your monthly pension when you're a pensioner. And the other thing is that the contribution files, people who say that yes, they did work and we have no record of their contributions, if they're allowed to present a sworn statement with monies paid in. And so this will affect the situation. So everything that I've told you about, what our idea is to improve affiliation coverage or membership coverage. And as you see, these are the true outcomes, just with changes in the proportional payments and the loan. There is already an increase in the coverage of pensioners, and this has increased in recent years significantly. And as you can see, the forecast for the following years, another important change is foreseen in the pension structure, basically through proportional pensions. And what happened with Marta? Today she's 68 and she was able to obtain her pension loan. She has a 15-year pension, and this has improved her lifestyle. The question is, how did it change your life? Oh, it's given me great uh, uh, safety, health, And also, I receive a proportional pension. And I can also continue to work in my business. And so that is more or less the strategies that we have implemented. I've gone through this very quickly. I apologize for having run in such a way. But the idea is to have a project to improve coverage and identify different sectors with special strategies for each sector and accompany this with better possibilities to access benefits with proportional benefits and full statements and so on. Thank you very much.
Muchas gracias.
Well, thank you very much, Victor Hugo. Very good presentation, and you kept to your time, so I thank you for that. And a very interesting case in Peru, proportional pensions, and also the national pension system, SNP of Peru. And now we will be addressed by Vasil Ramirez, who's the Planning Technical Coordinator for the Institutional Transformation of the Mexican Social Security Institute, the IMSS. And go ahead, Vasil, 15 minutes. Thank you. Well, I thank you for the opportunity to be here once again with you, and the doctor sends Dr. Laurel, sends you her special greetings. And Social Security is not necessarily pensions. We've addressed health. A health system is not to have an increased coverage or an increased service, but to improve the health conditions and the well-being of the population. During this period where we have been at the institution, we joined to extend these health services to the population that was without Social Security. For this, we did a full analysis in terms of the conditions that we could consider in order to extend the services. There's no single model or recipe, if you like, to implement this, leading an expansion of the services. But we need to determine the coverage of the services as such. There is an expansion in terms of coverage and also in terms of services. Two different things. We need to conceptualize the service. What do we have today? Do we or not have a right to health care and access to services? Can you obtain health services, but maybe not access? But so access to these services is very relevant. Is the service centralized or segmented? In the case of Mexico, we have a complicated segmentation, not only in terms of social security, but also healthcare. And so the idea is to have a single system. The institutional capacity, is it sufficient based in terms of human resources? What population will we cover in order to determine the coverage of the population and the health condition of the population? We need to get to know our population, the nutritional status, lifestyles, the characteristics of the population that we're going to address. And of course, financing, where will we get the resources from? How will this be distributed? And the political process. Okay, the political process is complex. I put it here as a reference, but it is difficult. So, we're speaking of universality, yes, but we do not know at a given time what is universality in health systems. Not necessarily an expanded coverage, because that would be essential. But yes, there is an expansion in the services provided, the healthcare services provided. Non-contributory population, in the case of Mexico, this is focused mainly on institutional healthcare at a federative level. Coverage was based on a catalog of services. And so what we want to generate is a single health system to have a coverage for the entities that may join the system and have a regulatory framework for basis, modalities, access to services, which is essential. We must specify who is obliged to provide the service. In 2020, or yesterday, as it was mentioned, Mexico made a number of reforms, and now the Constitution determines who is obliged to provide the service. These are the federative institutions. And if they join the single health system, so Mexico is in the process of centralizing the health services. It's a free choice for the federative units that would like to join, and participation is voluntary in terms of the health workers, and the transfer system must be seamless in terms of care. And so we are here to do a complex analysis. And for that, we need a framework to diagnose where we stand and have a diagnosis in order to see the scenarios where the medical units are, and depending on the capacity and the characteristics of these units, we consult external consultation to see how our infrastructure is doing.
Considering the auxiliary staff, the different times of waiting for the consultations, and therefore we try to conduct an analysis of our infrastructure in order to do the self-assessment and to know how we are doing in terms of the external consultation for the emergency units. And here, for example, we have a resolutive capabilities of the area if they have some rooms for hemodynamics and so on, and the different supplies and medications that are available. See if they have the electronic systems for the medical assessment right at the site, and the hospital evaluation, and also the different areas that a hospital should contain. If they do have these facilities, it's very important to take into account to have pediatrics and general surgery and the intensive care clinical analysis infrastructure of a hospital that is fundamental. If we don't have this battery of equipment, the personnel cannot provide the services. We have also the staffing from the administrative and medical point of view to provide the services to the population. Therefore, we're speaking here of some 11,000 units of first levels and 575 of second level and 45 for the third levels. In the units that are being incorporated, 23 of them are being now incorporated, and they are joining this single system for the whole population. That you have, for example, a personnel of 210,717 people, technical staff including 53,000 people, and it means that we have more people in the healthcare units, and we also have the technical personnel for this particular care. Now, I would like to underscore the service that is provided. We have to be aware of the utilization of the service, the medical services, how many of these services are provided at the first level, if they do have services at the rural areas, if they have the third level of service, and the rate of hospital admission they have at each one of these units. And this is a part of information and analysis that should be taken into account to identify very clearly the characteristics of each one of these entities to know what we're dealing with. And for this single system, we were able to observe on average that we have 1.8 on level, 1.2 on second, and 1.6 in the third level, and we're generating these admissions of 43% at the level or nationwide, and this is on an annual basis. Now, the main reasons that we are facing now, more specifically as specialties, nuclear, especially including the pediatrics, the general oncology, and the internal medicine. And these are the 10 hospital discharges that we have in general. So we have, for example, delivery and not specified abortion. It is therefore very important to have the gynecological unit to deal with all these federative units that we expect to unify. We should also know our target population, the population we're going to integrate. So we are interested in knowing the number of people who will join the single system. We are considering 78% of the states in the country, and obviously we have 52 million people who are concerned and will be integrated in the system. As far as the conditions for healthcare in the units are concerned, we need to know the illnesses of from the digestive point of view, the maternal breastfeeding, the diabetes cases, and the people with different cases that do undergo diabetes. If they do have or don't have a physical activity, the smoking habits and overweight, and we have realized that the overweight is very related to high blood pressure and diabetes. It's fundamental to know the data related to obesity and overweight of the children in order to know whether based on these conditions of lifestyle they have, they are very likely to be further deteriorated in the future and to have a chronic and degenerative disease. We needed to know also the cost of access to such services. And therefore, we had to create a methodology for calculation in order to establish and to know how we should do the costing. And based on the characteristics we had from different units in the federation, we had to do the costing by branches. In this case, we had to establish the rural population, the urban population, the conditions for each one of those populations to examine the different services that are available in the federal units, the first, second, third units of service, and the different costs for the hospital discharges to do the qualification. And therefore, it was very important to establish the guidelines in order to come up with a methodology of costing, allowing to let us know the financing involved and the financing that it really has. The Social Security, as such, is a system. Bismarckian system that has the contribution by the employer, the worker, and the federation. In the case of the healthcare system, we have the budgeting from the federation, and there are no additional contributions. Therefore, those resources that come out of the federation are enough to finance this single system is a question I pose. And in order to see the conditions to update our data and to see more specifically how we should um, do the costing. Then, concerning the methodology, we were able to do the financing of the universalization of the healthcare system. We established that for three groups: the population without social security, the population that does have this social security, and the extremely poor poverty population. And we have the lower limit according to the use of the state-run services that were integrated to this single health system. Based on that, we were able to measure whether we were able to tackle this with the budgeting we have from the different federal units and to provide the services of healthcare. Thank you very much.
Muchas gracias.
Thank you. Gracias. Thank you very much for presenting the expansion of the healthcare system for the population with no social security in Mexico. And thank you very much for observing the time limits. I would like to let you know that we have over 100 people connected online who are participating from Argentina, Colombia, Canada, Mexico, Costa Rica, Paraguay, and the Dominican Republic. And now Precisely, we have a presentation by Mr. Pedro Alcantara, who is the Director of Policies from the SDBS, the National Council of Social Security in Dominican Republic. Good morning and welcome. And contrary to what Mariano was saying yesterday, that he went from 0 to 32 degrees in Chile, I am experiencing coldness here in Chile. Well, I will speak about my experience as a director of policies of insurance that we have in the National Council of Social Security. I also was in the direction of defense of the affiliates that are the organizations that are I have been transiting to these different institutions. I do this introduction to let you know where we come from in this solidarity-based system and what are the major breakthroughs we had in Dominican Republic, the change of the law. That is to say, the first time we passed a national law for social security, and we divided the benefits in 13 schemes. So we have a contributive system, one that is subsidized, where we have the solidarity pensions, and this contributive scheme of pensions changed the name for the pensions, and it's called now the insurance for old age and survival. And from that moment, we started to face the same problems as in Peru. People didn't understand the situation beforehand. They could hardly understand what it was a reality today and how we would have this subsidized system with the individual contribution and those confusions and other previous works put this in. Behind the schedule. And in 2001, we had the first law, but the first pensions were provided in 2019 because first of all we needed to have a census to know what would be the target population to receive this benefit. Secondly, we needed to determine the amount because it was 60% of the minimum wage, and that is to say that we needed to have around $60 at that time, and the amount that people would expect to receive would be lower to the levels of poverty, monetary poverty, and we had to equate these to amount that was 60% at least and above the level of monetary poverty. In 2013, 2017, we started the studies. In 2018, we already had the instructions for a plan. The law also envisaged some problems of legal application to provide these pensions, and in order to have them in autonomous status, we had the councils for the development, regional development, that are instituted by province in the Dominican Republic. We have the senator from and we have these policies that do not allow the operational running. It is very difficult to let them agree. And till today, this is not working. And the council had to find a way out and to create an institutional commission of some institutions that were related to this process in order to start paying the solidarity pensions. In 2019, we started to pay the first pensions. When this is started in 2019, we saw few situations. First of all, there was a lot of red tape. The citizen had to fill out three forms. They were not adapted to the new technologies, and this compelled the council to issue a resolution every year to pay the pensions, and all the information was outdated, and the last updating was done in 2010. And when we met with the organizations that had to determine where the highest level of poverty were located, there was no tool available, and this compelled another institution to determine one person by person to see if they were eligible to receive these benefits. It was very difficult to move from that province to another to see if the people were entitled to receive these pensions. At that time, they had this amount of 10 to $15 million that were paid in pension. In very quick calculations, we can say that we were not able to benefit over 8,000 people. And based on the information, we have 1,700,000 people will be the beneficiaries. And so it would be taking a long time to tackle this. I'm trying to find a way out last year with based on the help provided by ICLAC and other international organizations. We did technical work to fix these hurdles we have for the payment of pensions in this graphic. I'm showing, first of all, that we overcame the fact of renewing the resolutions to pay the pensions, that is to say, the red tape. And the council didn't have to meet anymore to see the continuation of the plan. We now have a pilot study so that these um, hindering is not taking place anymore in order to develop these provincial councils. We also have increased the number of beneficiaries by using the new tools. It's not just moving to the place where the person lives to have an interview, but we're now using different kinds of tools that are different databases, as from the treasury, the um, Internal Revenue Service, to determine the level of poverty of these people. Reduce los costos.
This reduces costs, alleviates the technical work, and makes it all more operative. Now, there is a possibility of have survival pension that's still not a part, but the law says that we may provide pensions for the spouse or the partner of the worker. But there is a bureaucratic step that must be completed in these survival pensions. Now, one of the greatest complaints we've had during this period has to do with transparency. There is no single organization that um, spreads the information on the pensions. And many don't know what kind of who are the targets for these pensions. So we are now being more creative, going into the town halls to inform who has been receiving these pensions. And there are some who qualify for the solidarity pensions. But we usually say that we have more sick people than available beds. Sometimes then the budget is not enough to provide the pensions for all. But that is why we have to make a priority on who will be eligible. And this is behind the new resolutions. What's the process like? First, we identify the citizens, and this is CUBEN. That is the unique or single beneficiary list. And these are the person that will receive the Social Security benefits. If a person has already had access for Social Security, that person may qualify for a solidarity pension. And CUBank is the institution in charge of this. Allocation of pensions. This is under the Solidarity Pension Commission, under the Finance and Labor Ministries, as well as the Women's Ministry and the National Council for Social Security, CUBank, and the Older Persons Committee, as well as the institution having to do with people with deficiencies. And this is all part of the database. Then the budget is to be allocated to those who may qualify for that pension. This is all according to the database. Solidary pension certification. This is done by paying, and they then process and do the payment. Yesterday we heard about the fact that certain non-contributory pensions do not reduce poverty. But if we look at this graph, after we started with the solidary pensions, we then went ahead in reducing poverty. More than $1 billion was offered for the solidary pensions, and the goal was to provide 65,000 solidary pensions per annum. We must insist that the work conducted in was in 2022. That is when we encountered difficulties, but we still decided to grant these pensions, and that is why we went into this study. Let me say that it was truly the political will that pushed this ahead because there were so many legal impediments. And we can see how we have decreased the levels of poverty in granting these uh, solidary pensions. We see that there is a political willingness to continue with the solidarity pensions in spite of the party and the administration at the moment. There are many organizations that can do the oversight. We have heard that some of the legal requirements have not been met in these pensions. So we have had political will, but also the legislative work behind these pensions. And that would be it. Thank you for your attention. Thank you, Pedro, for your very clear presentation on the progress and challenges on the implementation of solidarity pension. And we will now give way to discussants. We have online Mr. Helmut Schwarzer, who is the head of Public Finances and Electoral Services from Social Protection Department, ILO, Geneva. You have the floor, Helmut. Good morning. Thank you, Andres. I will try to share my screen. Let me start out by greeting all of the friends gathered in this event. I'd like to thank ECLAC for the invitation to be here, especially the Director of Social Development Division, Mr. Arenas. I also wish to congratulate the team for the excellent work conducted and the project that is being culminated. I also congratulate you on the timely event. I'm afraid that I was not able to travel to be there physically. Let me say that I have been following the panel with three very representative experiences of what's happening in Latin America. Oh, we heard about three experiences that have common elements, common challenges, and it's interesting to hear about these experiences because each one has gone through a different path in trying to overcome the impediments and the challenges faced. First of all, it is quite clear then that in each of these examples, there's a big challenge of coordination and fragmentation of the institutions involved in Social Security. Well, I think that I've now been able to connect with the platform. Can you see me? Yes. At any rate, this means that there is a challenge of coordination because the institutions are really fragmented. And in this seminar, uh, this issue has been discussed, and there is a very timely project that ECLAC has prepared with many partners and with the funding from the German corporation, as well as, and this has to do with institutional development. Mexico, there we heard about the search for a single health system for the country. We also heard about the need for more coordination of all of the contributions coming from the different social security institutions. INSS is present in this workshop. And that is not by chance because INS is the institution that is leading social security in Mexico, especially from contributory means. And there are also different programs such as the well-being INSA that extends this service for those that do not have the contributory capabilities. I remember also the health reform coming from 2020. The idea there was also to unify the different subsystems. Somehow, though, this was undermined by the pandemic. It did not receive the attention it deserved. It also seems to me that the pandemic was the first um, real challenge faced by that system. In looking at Latin American countries during COVID, I was hoping, and I hope that this will be confirmed, I was hoping that from the pandemic we would also find positive opportunities, legacies that would be useful, such as, for example, breaking barriers in coordination between the different subsystems of Social Security. This was very, very needed because of the pandemic in order to face COVID. There are different coordination mechanisms in different countries that left their track. The emergency relief measures that were adopted by different countries did introduce some kind of uh, transfer in order to mitigate the effects of the pandemic. Often, these were temporary measures that were adopted and that ended after the pandemic. There are other measures that were adopted in some countries, and these in turn brought reforms. There is, for example, the example of Brazil, that the Bolsa Familia provides benefits. It was reformed last year, and this is what was inherited after the pandemic. In talking about the benefits after pandemic, digitalization of many administrative systems made headway. We heard from Mr. Victor Hugo from ONP Peru. He talked about the different mechanisms and channels to get in touch with the target population. In Peru, we also heard about the coordination between different systems. And this is, I'd say, a legacy that ONP must face, and they do it pretty well. They have designed systems in order to meet these challenges. They have come up with a design with parallel systems. There's the public pension system on the one hand and the private system on the other hand. So there are two pillars then that compete with each other, and that this brings in turn incentives towards what we uh, name a good economic system. The people with more income go into private systems, whereas the state has to manage the pensions or social security for the population that is more needy or with less income, lower incomes. This is a difficult situation that ONP is facing, and they're trying to manage it, and they're doing a pretty good job at it.
I have also been reminded of the formalization strategies that also at the ILO we always promote. The formalization, which is a set of measures that converge in order to address with measures from different angles, communication on the one hand, mechanisms on the other, affiliation mechanisms, and also mechanisms for sanctions. That is important as well. The idea is to have as a final outcome a rise in the formalization and the extension of pension coverage, which is important because it is an area where there is today less coverage. And so, this development of around 50,000 additional pensions in 2022 and 75,000 additional pensions in 2023 in comparison to 2021 is progress. Obviously, perhaps insufficient for the social needs in Peru, but nevertheless an important step ahead. And the coordination with e-health. We at ILO have had an excellent relationship with e-salud, which is the public health system, and could also provide further fruits. So once again, this issue of coordination. And then in the case of the Dominican Republic, Mr. Pedro Alcántara also demonstrated the need to address a certain fragmentation with different regimes and where people do not understand very well how it works, and the attempt to clarify for citizens and operate an assistance pension regime based on solidarity in the midst of a fragmented institutional environment. I'm likewise happy 55,000 pensions, and I have seen that these have increased in 2023 with an impact reducing poverty, reducing surely also social inequality, which is a theme that has reached us throughout Latin America and the world in general. So there are three ways to address similar issues, but also in different ways. And so the difference, for example, in the case of Mexico, there is a principle of universal coverage that has been adopted, and also from the viewpoint of financing, it was clear to me that the financing is mixed contributions and also contributions by general taxation that is used for this universal health system. I'm happy that the contributions have been kept because I believe that Latin America, mainly, but also in the rest of the world, there are people who say that we should move totally to a regime of basic pensions or basic social security systems, tax financed. I believe that that is a mistake. And I believe that maintaining the contributory pillars is good because social contributions are, in fact, the most important source of financing, seen in isolation from the social security systems around the world. Close to 57% of the resources spent in social security around the world, according to our estimates here at ILO, come from contributions via payroll. And there is no tax that can replace this. It is necessary to keep this and find a balance of contributory mechanisms and non-contributory mechanisms as a long-term strategy. In the case of Peru, the idea is to strengthen formalization measures and coordination. The principle there is contributory, and so therefore financed with contributions. And in the case of the Dominican Republic, the example put across is really from the assistance area, tax financed. So, in my opinion, these are three very interesting examples that show the challenges and the opportunities for developing the social security regimes in Latin America, and where after the pandemic we have the old challenges plus new challenges to be faced. So thank you very much. I do not wish to speak more than my assigned time to allow time for discussion with the audience in person and also online. Thank you for the invitation.
Muchas gracias.
Thank you very much, Helmut. What we have tried to address in this panel was outstanding experiences in Latin American countries regarding the expansion of the social security coverage in a context with a series of transformation in the labor world and an important proportion of independent informal workers. Yesterday, we worked with the world of labor in Latin America, almost 55% of informal work. And so we've heard of three countries, Mexico, Peru, the Dominican Republic, and who showed different initiatives in various ways of increasing the social security coverage. So we'd like to thank all three speakers. In the meantime, while the floor is open for questions, I would maybe like one of the speakers to have a time for reflection that I would also like to thank his words and maybe a couple of minutes for answers. But if you would like, anyone in the audience would like to ask a question, please raise your hand. Thank you. Victor Hugo, yes? Yes, thank you, Andres, and thank you, Helmut. And for my part, I have also learned a lot from the experience in Mexico and the Dominican Republic. As Raciel said, in terms of coordination, structuring in order to get these public policies to be successful, regardless of the system, pension, health, or any other social protection mechanism. This connection in the case of Peru and pensions is complex, as Helmut was saying. As the issue of the system that we have for pensions is basically competitive. That is, the person initiates their labor relation, and if they are affiliated, they will have to choose between the public system or the private system. And they will have to stay there until the end of their working life because there is no way of connecting the two. If they're in the national pension system and could, at some point, decide in favor of the private one, they would leave without taking the contributions made to the other system. And if they're in the private one, they cannot move to the public one. That is the structure that we have today, and that is how we have been moving ahead. And as Pedro was saying, based on the experience in his country, in the Peru, we also have non-contributory pensions through programs of the Ministry of Development and Social Assistance that is not connected to the other one, as Claudia was saying yesterday. And they were telling about this issue, the possible interaction or connection that must result in a complex policy where everything should be connected. But that is how we're working today in the country. And so it is necessary to continue seeing mechanisms for connection for the two models to work and clearly should favor citizens in the country. Thank you. Thank you very much, Victor Hugo, Raciel, and then Pedro. And we have a question then from by Noelia and Slavina and Sandra. Yes. Yes, just to add that the transition that we're going through at the moment is complicated in terms of coverage, access, and the utilization of health services. We are in a process of construction and, well, to equalize the services today provided by each state secretariat and emulate what has been provided in the ordinary ease. And so this is a process that will take some time. It is a change process of restructuring of services, coverage, and care. And it is being achieved. But it's a process that is still ongoing. We're still building the medical units. So it is a process that will take its time, but we're hoping to have an opportunity to see this in further years and with different government changes that the practices be improved to have a single pension and health system. Thank you, Raciel. In Latin America, we have similar challenges, coverage, financing. In other countries such as mine, we also have an issue of digitalization of the information that is be shared and connected among institutions. This is a significant challenge because there is information that we do not have regarding citizens or the provision of benefits, and it would make life much easier if we had this connectivity. And an additional challenge as of 2020, the change in the labor market. Our labor market, same as Victor Hugo mentioned in Peru, has changed. Today we have people living off digital platforms, creating knowledge, and they are, in a way, independent workers. And that independence varies in informality. And so we have a higher level of informality on the one hand. And so therefore it is an important challenge to design pension systems for these people because this changes the target population of the non-contributory. And the figure that we had previously is going to be increased because these people do not have coverage regarding, despite having an additional income. And so far, we've not yet prepared anything, and this is one of the most important challenges that we face as a country. Thank you. Well, thank you very much, Pedro. Okay, now we recognize Noelia Bernal from Peru. Can you hear me? Yes? Okay, first of all, I would like to thank Alberto, Claudia, and everyone at ECAC for the invitation. I'm very happy to be here. I arrived when Victor Hugo was giving his presentation. Congratulations, Victor Hugo. You are a great representative of our national pension system. I simply wanted to share with you a couple of minutes reflection since we are discussing ideas or strategies in order to extend our the coverage of our pensions for our informal independent workers. And Victor Hugo was mentioning what they are doing. Well, I agree with what has been said in that our labor markets in most of our countries in the region are predominantly informal. And it is necessary to devise strategies in that context. We cannot continue to trust our traditional strategy of having systems based on formal work contracts because we have seen that this does not work. And in addition to low levels of productivity, human capital, and so on, but given this context, we need to have parallel strategies in both dimensions. On the one hand, the labor side, for example, programs that encourage the creation of more formal employment, for example, with incentives and so on. Y por el lado
On the other hand, we have to consider the pensions because this is more peculiar to our discussion and the heterogeneity existing in our self-employed people, and we have to think therefore of different strategies for these heterogeneous situations. We could specify them in two. On one part, we have the compulsory part of it, those who can, and to foster the voluntary saving. On the compulsory part of it, we have some countries that have included this obligation of the people to contribute. Chile is an example of this, and some other countries have joined also this endeavor. And Chile will better detect the situation later on, but we think that we still have the contributions because we can have a law to compel people to pay, but how we can manage to make them pay. And that is a reflection I wanted to make. On the other hand, we have the voluntary savings. We should have different strategies. One of them, as Victor Hugo said, is the information dissemination to make it simple, down to earth, so that the citizens can understand the benefits that are provided. We're working with Claudia and Victor Hugo in a strategy in order to provide information through the texting, through the cell phones, through the affiliates, through the pension schemes in Peru, so that they receive this information in their cell phones. Very straightforward information concerning the benefits of these novelty pension schemes that we have with 10 years of contributions that can be very appealing for this segment of the population, that is, people who cannot contribute for 20 years. And we think that this strategy of information to cell phones and ideally linked that in a way that can affiliate these people automatically and also allowing instant debit, that is to say just with 3 clicks the person would be affiliated and contributing to the system. And that is an idea that we have as a strategy to expand the affiliation of those workers. On the other hand, we have the fragmentation of the contributions, as Victor was said, and then we have the massification of the payment channels and the use of technologies. We already spoke of the platform workers, and as a matter of fact, the world of labor is changing. There are more and more workers and young people, more particularly, who are willing to work in these platforms, and they have multiple time slots and different employers. Sorry, it's not just the traditional kind of labor as we studied from many decades, and now we have to adapt to those changes. In this regard, what we can do is to have agreements with Uber or some other platform-based systems because they do have the records of these providers or the associates, as they call them, because they are not referred to as workers. Therefore, we need to be proactive and to use this technology. We also have the digital money. wallets, and this is something that is very easy. Instead of doing monthly payments, they can do daily or weekly payments. This is just to give you a general idea of the different strategies that we can put in place, and I think that we should implement those strategies in order to keep expanding the coverage for the informal worker. Thank you, Noelia. Thank you for showing the different strategies that are taking place in Peru. That could be an example for other countries. We just have 5 or 6 minutes, and we have 3 people in the room who would like to take the floor. I will give the floor to Slavina. You have the floor, Slavina. Of course, you.
Buenos dias. Many thanks to the three presenters. These were really insightful presentations, and I really liked the video spot on the Martinez life. I think that indeed this is so important as it is related to transparency of social protection, so access to information, and another dimension that you and earlier you mentioned is simplification also of procedures, of rules, etc. But this is not my question. I want to follow up on what Helmut said. And I indeed think that what I see in the region, basic pensions are essential to alleviate poverty. In Europe, basic pensions are essential to reduce poverty, which is one of the dimensions of the pension system. So while pay-as-you-go pensions are really key in order to maintain decent standard of living. And I see that the situation here is obviously different. But my question is, what's the role for employers? Because in Europe, the share of social contributions are it's shared between employers and employees. What's the situation here? And it's not a question only to the three of you, but maybe to other representatives of other countries. So thank you.
Muchas gracias, Slavina.
Thank you, Slavina. And maybe we can complement. We'll give the floor now to Sandra and to Dr. Delsin, and then we'll come up for a wrap up. Sandra, you have the floor from ICLAC Mexico. Thank you very much. I wanted just to ask a question, mainly addressed to the representative from Dominican Republic, because when considering what Mr. Ramirez said, the access to a pension is also linked to the access to different services. And there is already a dimension of the services that pensioners can have that is rooted in the institutions that serve the old age people, as we have CONAPE in Dominican Republic, CONEPAM in Costa Rica, or INAPAM in Mexico, so on. So, if we think that the social protection doesn't just mean the association, but you had said the coordination is a very important point. I would like you to elaborate on that. How these coordination systems were to include the CONAPE, that is institution of the old age people, and it's not the case for other countries where the social security systems function in a completely autonomous manner without being associated to other associations who are serving these target populations. We will give the floor now to Dr. Cid. Yes, I have a question for Victor Hugo Montoya. In Ecuador, we have a social security for the peasant population that is apparently successful. And out of the examples that were exposed by Victor Hugo, all of them are related to the urban setting. And I would like to know what kind of experiences you have in regards to approaching the rural setting, more particularly the more impoverished sectors as the peasants. Thank you. Thank you, Dr. Seed. We also have some questions from the people online regarding the immigrants, how they could join the pension system and taking into account all the migration patterns that are taking place in the region. Well, before answering the questions, I would like to make a comment. The importance of the points that have been raised here, the bridging of the gaps, of the people we have here, the missing middles. They are very important population that has been studied by many of the social protection schemes, and we should insist in the need to move towards these more comprehensive systems. And we need to have the linkage between the contributive and non-contributive systems. This is not the case for all the countries. Very interesting how in the Dominican Republic they do have the coexistence of these two kinds of pension systems, and I think that this is a very relevant point. We should underscore also in connection with the Helmut's comment the need to continue to reinforce the system of contributed schemes because for the sustainability of the system, this is a key factor. And in this regard, we should think of a system because Helmut, I think, has developed a very important study about the rural pensions in Brazil, and we could further explore that in other countries of the region. Thank you, Claudia, and we will give the floor now to the panelists. I hope that you can elaborate on these issues in 1 minute. We'll start with Victor Hugo. Thank you, Andres. Andres has been very strict with the time allowance. Well, very quickly, we have coordinated with Noelia this issue of the information on how to reach people, and this is in the framework of everything that has been presented here, and we are moving forward with the cooperation of IGLA. Karina, your question was very clear how the employer is participating. And in the Peruvian case, in the private and public sector pension funds, that the worker is providing the 13% and the private system 10%, and there is a commission for the FPs, and then or the pension fund administrators, and then 8%. And other schemes we have contribution by the worker and the employer. I would like to respond to Rafael and Lavina. In Peru, and out of the classical systems or in the national system of pensions, that at the same time some specialized schemes for the miners and the civil construction workers and so on. For the workers, there is a different situations compared to the urban setting. There is a scheme for the fishers and specialized works, but for those who work in the industrialized ships. And in this case, we have a contribution that is shared by the fisher and the employer. And then we have a fund that is built up by the different contributions of the fishing activities and the selling of the fish products. Now, concerning the peasants or the rural worker, there is no specialized scheme. In this case, applies the general system, and this is a strategy that we showed in the identification of the different sectors that we could have in order to move forward as a target group to have specialized information. And in there we have the farmers and the fishers, non-industrial fishers, who are those who are working in a boat and bring the fish products and sell it directly for consumption in markets. So we have to know them better. We need to know their ways of communication, how to approach them. In the case of the fishermen, it's very difficult to have a particular time schedule. And in the case of the peasants, in the rural setting, maybe they do not use the technology or smartphones or more classic cell phones in case they have them, or how we can reach them, how they use the water, and we need a whole strategy to reach them, and that is part of the process we're embarked upon to reach them properly. These people who are in the rural setting and the fishermen. Well, concerning the migrants, there is a lot of concern around them because there are problems of the adding up of the different contributions from their origin countries and the receiving countries. They do not have access to those contributions because they don't have identification. We need to speak with their own language. There are some regions in Peru where they have centers or zones that are specialized where they hold meetings and services for migrants from different areas for labor inclusion concerning also the documentation, and we also want to include there the social security issues. Most of the migrants will stay in the country. We calculate based on the last study 75% of the migrants who are in the different countries tended to settle down, and only 25% of them are continuously moving around. And they have their children, they have the children at the schools, and therefore they have social insertion. And we also have to take care of their social security because in a few years they will be entitled to the benefits. And in our society that is multicultural, therefore will have many problems in the future. And this is another area that we are exploring, that is to say, migrants. Thank you, Victor Hugo Maciel. You have the floor now.
Thank you, Victor. In Mexico, the contribution to social security is a system that exists. In health, we have federal funds. There are several institutions in social security institutions, and some have their specific conditions, and they have the quotas for the payment. Thank you. Eslavina, I have a question on the workers' participation. There is a share of what is paid in Social Security, but this is paid in different ways. One has to do with direct payments, and that goes to the non contributory pensions that come from the national budget. They don't come from Social Security. On the other hand, part of the contributions that the employer pays goes to Social Security, and amongst this, there's a small share that goes for the Solidarity Fund, and this fund goes to the individuals who have not been able to pay their contributions. These are the two means of contribution from the employer. In Dominican Republic, we have many subsystems. We have subsystems for teachers, for the police force, for members of Congress, etc., etc., etc. And then Sandra, you asked about the integration of CONAF and non-contributory uh, systems. Well, we have a law coming from 81. When that changed into pay as you go, the CONAP delivered what seems to be non-contributory pensions for more vulnerable individuals. When the commission was set up, as I explained, then CONAP, because of the experience they had started paying these pensions. There are other things that we have as part of the system, and these are the health plans. We, as country, believe that the retired persons didn't really have a health insurance. Since 2008, decrees were enacted to grant health insurance for these persons. But in 2016, a pilot plan was created. Now, when entering the subsidized health system, these persons started having a health insurance as well. This has progressed, and we have 98 health coverage in Mexico, subsidized and with contribution. Aside from this, the state does have institutional agreements with different groups, and these have special plans for pensioners. For example, if somebody wants to change the flooring of their home, many houses have just uh, no flooring, and this means that this person can apply for a special fund to revamp the house. As to the migration, we have a national law from 1948, and many of the persons who benefit from that were from sugarcane plantation, and many of these workers came from Haiti. They worked in the farms. The sugarcane workers did not have any documentation, but they used a working tab, shall we say. The government then gave pensions to these workers based on their tabs and on what they did in the sugarcane industry. But then things changed and we started following international agreements. We now are developing an agreement with Chile. The embassies are uh, talking about this. We also have an Ibero-American agreement, another with Spain, with El Salvador. And the idea is to share pension plans between these countries. But we do have a legal and an illegal migration. In order to grant the constitutional right for a pension that is so in Mexico, we have had to follow some operations, such as, for example, having in mind the working files of the sugarcane workers. Thank you, Pedro. Helmut, are you still with us? Are you still there? Yes, indeed. Thank you for the opportunity to be here. This is a very interesting debate, and I find that the questions are also very interesting. At ILO, we pose questions having to do with the pension reform in Colombia. At ILO, we would not give an opinion in public. Colombia has looked for opinions from ILO, and we have brought about information on 102 agreement. We have explained the rules and the minimum standards that the countries must follow. In referring to these three countries, why they have ratified this agreement. So these are criteria that must be studied, must be assessed, and because they're related to the functioning of their systems. What's interesting about Colombia is the search on how to decrease the stress between different subsystems, how to better coordinate these fragmentation, how to have a single unified system, and what's happening with the role of some institutions that will not compete with the private ones. Because Social Security is not just a saving, it also involves a solidarity. And that is why it involves contribution from the workers, but also from the employers and from the state through taxation. This discussion that in Colombia is very, very interesting. We have to follow what's happening there. And I do wish these three countries will be very successful in their efforts. We must bear in mind, though, that the coverage gap is a result of many things, such as, for example, lack of investment in Social Security, lack of funding, and little efforts on the part of the society to cover that. We have issues of governance, and therefore, this discussion has brought about many elements that we from ILO have identified. Thank you very much, and I wish you success. Thank you, Elma, Helmut, and I thank all of the participants from this panel. I remind those who are online to please fill in the surveys. That is very important for us to improve these events. I also now adjourn for a well-deserved coffee break and in-house um, information. We do have simultaneous interpretation available, and there is a missing headphone. So whoever has that headphone, please return it to the officers. Thank you very much, and we'll be back in 15 minutes.
La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ de activación transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ de activación transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ de activación transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ, Reactivación Transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ, Reactivación Transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ de activación transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ de activación transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás. La pandemia de COVID-19 dejó profundos impactos en América Latina y el Caribe, que reflejan la alta vulnerabilidad que enfrenta la población ante las crisis. En 2020, la pobreza afectó a 1 de cada 3 personas en América Latina y se profundizaron las desigualdades en sus diversas expresiones. Entre marzo de 2020 y agosto de 2022, los países de la región anunciaron 506 medidas de protección social no contributiva de emergencia, según la información recopilada por la CEPAL. Pero esta inédita respuesta no fue suficiente. A la crisis sanitaria se sumó una crisis silenciosa en educación y una crisis en cámara lenta en materia de inclusión laboral. Según los análisis realizados por la División de Desarrollo Social de la CEPAL, en el marco del proyecto CEPAL BMZ-GIZ de activación transformadora, superando las consecuencias de la pandemia de COVID-19 en América Latina y el Caribe, es clave fortalecer los sistemas de protección social para cerrar las brechas que persisten en la región y hacer frente a un contexto marcado por una estructura reconfigurada de riesgos. Resulta fundamental expandir la cobertura de la protección contributiva y no contributiva, incluir a los trabajadores informales e independientes en los sistemas de protección social y reforzar los vínculos con las políticas de inclusión laboral. Estas medidas tienen que ir de la mano de sistemas universales de salud, de sistemas de educación de calidad y de políticas integrales de cuidados si se busca cimentar sistemas de protección social universales, integrales, sostenibles y resilientes. Solo así, América Latina y el Caribe podrá avanzar hacia el desarrollo social, inclusivo y sostenible sin dejar a nadie atrás.
Buenos días, señora Castillo.
Good morning. This is an audio test. Everything seemed all right. Thank you.
Sí, en su momento. Si quiere probar ahora, no hay problema, vamos a probar. Sí, con la pantalla inicial vemos compartir contenido. Perfecto. Sí, se recibe perfecto. Muchas gracias. Luego le van a dar el pase en su momento. Muchas gracias, hasta luego.
Buenas tardes, vamos a partir, por favor les pedimos tomar asiento.
Please be seated in order to begin with the next panel.
Bueno, 10 minutos.
So, good afternoon, everyone. It seems the coffee break was very good, so thank you very much. Good afternoon, everyone. We will now begin our panel 6 roundtable, very high level, to address one of the topics that has been an emerging but most relevant topic during the pandemic, and that is the role of social registers in the digital transformation of social protection, and that has been spreading in the region, that often come up against the challenge of not having the right or timely information to quickly reach the population that could be requiring key benefits for their well-being or even survival in some cases, and so improve their living conditions. And so the role of these registers, beyond what is traditionally known and recognized in Latin America, more linked to the priority setting of the supply, must be extended to other groups that also require specific support at given time. So here we have a very high-level panel, and we thank everyone who is taking part both in person as well as online. And we will begin first with interventions by 5 people, ministers and officers of very high level at government level, and then finally the panel of discussants. We will have no more than 10-15 minutes for the presentations, and then we will move on to the discussion. And so first of all, I'm pleased to introduce the Minister of Social Development of Costa Rica, Yorleni Leon. The floor is yours. Thank you. Thank you, Claudia, and good morning, everyone, and especially those people who since yesterday have been following the broadcast. I also thank the speakers of yesterday and this morning who have made significant contributions and very, very relevant contributions regarding the topics that have brought us here today. And so this has been of very good level. As Claudia was saying, we're going to speak of the social registers, and I'd like to begin with a statement that says that the social registers are here to stay. As simple as that. I see no way of addressing all the major challenges of social policy in each one of our countries if not accompanied by social information systems that allow us to have a greater capacity to make important decisions and strategic decisions with regard to social matters. Having said that, the social registers and their relevance, I would coin the impact that these registers are able to have at institutional level. Each day, we can see more clearly the marginal value of these social registers in order to carry out the policies. Because especially in scenarios as complex as the ones that we're seeing today, And this cannot be seen as a justification in order to address or not address these people. This is a reality. The scenarios that we have today uh, uh, and that face those of us who must respond to these situations, we are facing challenges that had never been dreamt of before. For example, reduction in the economy in many countries, climate change that was unknown to us about a decade back, and it has to do with migrant flows. In the particular case of Costa Rica, so much faster and larger than the flows that we were used to before. And of course, this also has to do with the aging of the populations. In the case of Costa Rica, that is a country that has a birth rate that is negative and a aging pace which is very fast, and which means that the social policy is in an unprecedented situation. And so, despite all of this that we are seeing, the social information systems and the relevance that this has acquired in recent years, because many of the countries in the region and also other parts of the world see very clearly that these social information registers and systems are heterogeneous. Not all countries have the same databases, not all countries share the same variables, not all countries have the same pace, not all countries have the same levels of accuracy and precision, such as countries such as Chile, for example, that have social information systems that are pretty well consolidated and that go back quite a long time. Now, despite all of this progress and recognizing the significant differences of the social information systems, it is important to point out some of the gaps that these systems have. For example, coverage. Today we have highly differentiated coverage in each country, and in the case of Brazil, Ana Gabriela was saying that there's approximately 40% of the population covered. Of course, the country has a major population, but in Costa Rica we have 86% coverage throughout the country, but also our country only has 5 million inhabitants. And so we're talking about access barriers, access gaps. Not all everyone has the same chance of accessing this sort of tool. And how to facilitate all of this is one of the major challenges that we are facing. And also, we have gaps in the configuration um, to determine the social inclusion or exclusion variables in each one of the systems. The accuracy of the quality and the information or the total or partial absence of protocol to help us see shortcomings such as the temporality of the data 1 year, 2 years, 5 years, months, no more, no less. This will be daily. These are all matters that we've not reached an agreement on. But an agreement would allow us all at some point to have a basis for our social protection, and based on that, being able to make important exchanges of information to not only nourish our social information systems, but also nourish the social information systems of other countries. And this would allow us to move ahead far more accurately and orderly towards the reduction of poverty in each one of our countries, which is, of course, the ultimate goal that we all aspire to. And we also have important gaps in terms of the use that people give this information. And that is analyzed in these databases and the type of beneficiaries for which these social information systems have been designed and configurations in general. However, and despite this, there is each day more consensus, as we were saying at the start, regarding the need that countries have to have information system of social information. Of course, from the viewpoint of technology. And when we're talking about social information systems, this is larger than a mere social register. A register is just one component of the many that an information system could have. But even when it is a basic system such as a register, this does not detract from the relevance of our interest to have technological tools. And that is because the outcomes, even if the basics are very system, the outcomes are very acceptable to all. On the one hand, the citizens, and also the treasury, because what they do is more transparent, more trackable, and a greater control of the resources that finance assigns to the social sector. And for decision makers, such as the legislative branches in our countries, this information generated by the social information registers is important because it allows them to sit down and have conversations with others, and very much based on the data on what is really happening in each one of our countries. And this then would, in some cases, would allow us to direct bills or aim them bills to strengthen the social policy. And of course, this is a great opportunity for the institutionality of each one of our countries. Albeit we are facing the same budgets that year on year we're working with, and even when we face the same programs, the fact that we are using tools such as social registers or tools such as the social information systems mean that there is a significant change in the institutions, in the way of thinking of policy, the way of addressing and doing or implementing the policy. And I believe that this is no minor outcome, but it is highly significant. This is definitely another way of ensuring the social policy. I repeat, even when we have the same budgets, the same programs, the same populations, doing it, but using technology, which is far more comprehensive, this means that the same institutions, the same officers see a clearer way of carrying out or implementing the social policy. Let me share with some achievements in Costa Rica based on the single register of beneficiaries, SINERUBE. Since 2022, late 22, we began a very serious project to make the most of a tool that we had in the country that went back more or less 10 years. But that, on account of several reasons, was there very much unused. And so in the last few years, we've been able to include a number of institutions and programs and persons into the tool. And this has allowed us to today have a much clearer profile of the people addressed with our social policy. Elderly people, people with disabilities, women heads of households, people living in urban areas, indigenous people, Afro-descendants, and so on. And this has allowed us to assign resources to certain sectors, certain groups, certain territories. In 2023, for example, 73% of the social sector budget was assigned to address people living in extreme poverty. And this had never happened before in our country. And with this, I'm not saying that the rest of the population does not have a right to be benefited, but the fact is that people living in extreme poverty face difficulties that are far more complicated than people who are in other categories. And so 73% of our resources were assigned to these groups. And so we've been able to uh, and study and decide when we have new needs for the program, or if we do not have complementations possible, how to build them. And this has allowed us to uh, benefit far more accurately the people who are living in dependence and that need us aid, or people with disability. And we see how there are changes made, and little by little we do the complementarity analysis in our offer of social aid. In 2023, we began with the first phase of a single window for social benefits. And in that year, 377,000 households filled out the form to receive care. 377,000 households. That is no mean figure. And then, through the analysis of the system, what the people fill out, their data, and so on, there is a system behind the form that there's a priority setting of the household. And so we uh, uh, assign the care to people who are in a priority situation, elderly people with health conditions or very young children, and so we assign 243,000 care services uh, prioritized by aggravating factors. And so people were informed of their appointments and the people who were going to see them. 42% approximately of the requests we received last year were from households that were not living in poverty or extreme poverty. And that meant that straight away we do not see these people. What a difference! Not seeing them because up front they're not living in poverty or extreme poverty. So this has been a major saving for us because we were able to detect them immediately. And so our people could go to the field. And so we're reaching indigenous people, areas where income is not easy, and we have visited. So I know we can't go all the time, but one we had said that we will be revisiting the indigenous territories in our country. But if we had not enjoyed this sort of tool and resources, probably today we would be only just finishing to see or receiving the requests of these people who are in no urgent need of a cash transfer from the government. And so we were able to prioritize the people and see who was in a greater need. And that was possible only thanks to the social information register. And so detect disabilities or people living in total dependence. And so by 2026, our expectation is to include the record of persons' independence and call baremos, which is sort of barometer to determine the level of dependence of affecting these people, and so share the information with the rest of citizens, or rather the rest of institutions, better said, and so have a special ID card for these people with disabilities for this to be made more visible, and an important criteria when it comes to give a benefit. And also, by 2026, we will have two baskets. One is a disability basket, which is a differentiated basket for those people that have some sort of disability, and another for dependents, which will be a differentiated basket in comparison to the one that we have traditionally used and that is applied to most cases. And so I repeat the relevance of the tool, such as what we have in our country, and that I repeat is not a consolidated tool as we would like. There is still a long way to go, but we have been working to strengthen it more and more, and so progressively increase the state's capacity to implement the public policy based on far more accurate tools. I would also like to say that the challenges we face are the following. One, to appreciate whether it is possible to have a social register or a social information system which is basic for all countries. And when I say a basis, it could be based on the social information card, most such as the one that most countries have and that might share with variables such as temporality, what should be the temporality of our registers, how to collect these variables, and certain procedures such as the quality, the claims, and so on. All information that will allow us to share and do compared analysis among countries in order to better understand and specify our efforts as a country.
I think that this is also a very important challenge, including the universities in this whole process, because I think they can become very important players for building everything that is required for the social information system in Latin America. On the other hand, one of the challenges is to create a sustainability and allow sustainability for those systems. I think that the international cooperation plays a significant role in order to help us to build this basis for the social information system that is fundamental for the decision making process. And I wrap up here. Thank you very much. Thank you very much, Minister, for your intervention. I would like to highlight this perspective about what we try to put in place these dynamics that is sensitive to the differences and to include the segments that have been historically excluded. We were speaking about the self-employed workers, but we have seen also the structuring access in authority in the region. So we have to consider the First Nation, the Afro descendants. You also mentioned the population that is a migrant population as part of the challenges in order to have the public offering. And it is very important to have those information system updated as well as building the variables that can be significant in order to report those needs and therefore to see how the quality of information and the information coming from the citizenship can be conducted in a transparent manner and contributing to reinforce the systems of governance and accountability that is fundamental. I would like to comment also that the minister was a driver for the regional conference for social development in Latin America and in the Caribbean. And she put in place this group of discussions in the Ministry of Social Development about the social records. Next, we'll give the floor to for the intervention of the Minister of Social Development from Panama, Mrs. Maria Inés Castillo. Fortunately, Minister Castillo was not able to be here with us. We know that she was scheduled, but however, she would like to be virtually present, and I would ask you please to support me with the connection from Panama with the Minister. Well, good morning. Uh, Actually, we propose what God decides. And, well, I would like to meet you all, the delegates from ECLAC and the specialists from the IDB and the members of the diplomatic corps, the representative of the civil society, delegates from the country. I'm expected to be with you there and arrive at Santiago by 6 of a.m. this morning, but I had health issues and I was not able to do it. Well, if you allow me to share my screen now, we would like to thank the German Corporation NICLA to invite us to participate in this meeting and the role of the social records vis-a-vis the digital transformation. We are committed to do the accountability in favor of the most vulnerable populations and facing these crises that we have today, and we are focused in reinforcing this social protection in our country. We'll be dealing with the challenges and the restrictions for the social protections and centering or focusing on the social records for the eradication of poverty, and we'll deal also with all challenges related to the climate crisis and the social records that are required. Concerning now the social protection systems and the challenges, the pandemic affected our society, and the social protection system has acted as a stabilizer, and they played a significant role for mitigating these impacts. On the other hand, they also face very important challenges, for example, the overloading of the services, the lack of resources, and the need to adapt the policies to the new needs, particularly in terms of the social protection. We have to identify the specific needs of the new vulnerable populations that arise as a result of the pandemic. Also, setting the priorities for the approach. The challenges imposed by the pandemic, I consider that translated in many learning experiences for the country and expanding the um, array of opportunity that we have to be more resilient. That we were able to dynamize the policy of the government and improve our social policy in a coherent manner and addressing all the changes in the population that includes changing also from the cultural point of view. Concerning now the structural challenges, including poverty, inequality, and exclusion, require comprehensive solutions from multiple sectors. The universal policies that sensitive to differences are the basis to this system, and we don't need just the well-designed and implemented public policies, but we need to do the monitoring and the adequate assessment with the pertinent financing to guarantee the viability of these systems in the long run and let them be sustainable. Now, the emerging challenges from the social protection includes a series of challenges that put to a test the efficiency of our social protection system. Among them, we can highlight the demographic transitions that have been alluded to previously, also the epidemiological pattern during the pandemic, as the nutritional issues, the climate crisis, the increase of disasters, and also the technological innovation. These are challenges that are common to all citizens independently, regardless of their economic or social status, and therefore it should be considered within the social protection systems. We have also need to establish the different territories, and that's why it's very important to tap the best out of the best new technologies. And this requires to have a comprehensive response from the countries, reinforcing the social protection system so that they can respond to the new needs. From the social protection ministry, we recognize this policy that should be agreed upon and comprehensive. The poverty is multidimensional, and therefore we need to do things well based on evidence. This is hand in hand with reinforcing and providing the technological tools, facilitating the efficiency of the social protection systems. Well, The records that we have for the beneficiaries of the social protection system is highlighting the poverty and the extreme poverty population. Something that the uh, pandemic unveiled is that we should transit to the universal protection, social protection system, including the population with higher income levels in order to link this together and to learn other times of crisis, including pandemics or climate issues, and this translates into an increase in of an increased coverage for the protection systems. Also, we need to continue investing in the reinforcement of the technology in the country to have more interoperability of all systems. And what is now the role that the protection, social protection mechanisms play during the pandemic? I would like to speak about Panama at that time. At that time, we didn't have the social records for the households. At that time, we didn't have that in operations, and therefore is restricted in a certain manner reaching the population quickly with the digital bonus that we provided to the population as an emergency that included the digital payments, but we didn't have the basic records, and therefore we have to interact with the civil register. And then some other tiers were included as the public registry for properties, including also other mechanisms in order to target the resources during the pandemic. Likewise, the social records allow to target those programs, and we continue to struggle against the poverty and try to bridge these gaps of inequality, because this is not only the role of the institutions that should guarantee the universal rights, but it's also important all the support that can be provided by the services that are related to the public opinion and why the importance of the social records in a digital era. Well, they facilitate the access to information for both the citizens and the researchers. We previously alluded to the academy, the universities that role a very important role for social records. This allows to identify precisely the household with poverty or extreme poverty conditions, and this is the direction that our country is heading to. And we have in the social records of people from poverty and extreme poverty conditions, and we expect to widen this coverage to the higher or highest number of people, particularly the people who are vulnerable vis-a-vis the climate crisis, so that we can provide them with this support in case of emergency. This also facilitates and prioritize the resources so that the benefits can receive for those who most need them. We also have the efficiency of the public policies that allow to do the adequate policies on the territory based on the data that we compile from those social records, and with the information based on evidence and verifying of the efficiency, also the territories that require more support, as well as the transparency and um, accountability issues that the citizen is requiring today when there is too much polarization. In Panama, for example, we are highly criticized for the programs of the condition cash transfers that do have an impact. And people want to know if they are reaching the people who most require them. And this information, this digital information, in a transparent manner, as well as in an open manner, would allow the population to verify Whether this is taking place in an effective manner, this gives also a comprehensive overview of their needs and facilitates the adjustment of the social programs, allowing at the same time to customize them to the needs, including, for example, the issues of the climate crisis, the aging of the population, and the system of care. This allows to provide permanent and comprehensive solutions that have finally touched the most vulnerable sectors of the population. The social records in the latest years have some challenges, as the lack of resources in order to have the adequate social records for our population, although this has been digitalized and we can use the information that the population provides through the information systems or the website pages. Nothing finally will replace the fact of being in the field and to see firsthand this information to be at the households. And to this end, we need to have financial resources. Although it is true that we can exchange and interoperate with the operational records, it is very important to be on the site, and therefore we have some financial restrictions because this requires to have a staffing from our ministry inside or to devolve this responsibility to the local governments that also requires to equip them with technologies and with abilities and also training. Another challenge are the gaps in the technological infrastructure. Although at the Ministry of Social Development we have a comprehensive information system, the compilation of data from other institutions represent a challenge, as well as the lack of coordination between the entities, the organization, and sometimes in these cases, the linkage requires to have some agreements in order to have this information.
There are privacy and security issues. It is a challenge to avoid undue use of the information, but it is also true that data protection laws also become a hurdle for our institution to share information. Monitoring and assessment often compromises the integrity of the information. This is the timeline of the social transformation of social records in my country. Even though we started in 2009 in Excel, we now in 2021 were able to have a national single registry of beneficiaries. This is a national system, and that was in the middle of the pandemic. But before this, we didn't have the system, but by 23, we opened it for a system to include even more of the population. Here we are able to include the people in the literacy program, in the attention to infants, the care system. We are also uh, working with geo mapping, and this is very important to care for emergencies, especially climate change disasters. Challenges in this digital transformation of social records. For this, we have to increase the coverage of beneficiaries or of persons and households. This indeed requires a greater institutional capabilities of all types, as well as further resources. And as I said, data protection, which I believe is indeed a two-way challenge. Now, digital transformation is very important to strengthen social protection systems, to improve the quality of living of the persons that are more needy. The data generation allows us to strengthen the institutions in terms of uh, public supply. This is indeed very beneficial. The idea is to go forward into sustainable development and leaving no one behind. That is very, very much related to the effective management of the territory, strengthening local governments in order to be autonomous. And that's a big challenge. This must be based also in citizen participation and accountability, and we must raise awareness of the differences that are common in universal policies. The idea is also to see the peculiarities that each territory has. The digital transformation is an institutional challenge. It involves resources. It also involves restructuring the system. In Panama, in my country, everything is in the social development ministry. And with that, we must do a national registry, including other social programs coming from different government agencies. And this should come from the federal system out into the rest of the country. There are many responsibilities involved. Now, we're talking about the cascade of crises and the digital transformation. We must do institutional and modernize public management with firm policies that will innovate processes and that will improve productivity and public spending with AI, big data, and botching. We wish to continue using new tools in order to be more efficient, consolidating all processes in order to have a positive exchange of information. We must also leverage the capabilities of beneficiaries as subjects of rights. And actually, the modernization goes through digitalizing all information. This is key to improve efficiency and social protection. It will also allow us to reduce poverty so as to better attend the population that is more needy. We should do this with a culture of responsibility. They all ensure that the benefits will be delivered. This means updating information and exercising the rights of all. The population should know more about the benefits of social records, the benefits of being a part of it. And that's not just for the more vulnerable part of the population, but for everybody. We must ensure also the reliability and the confidentiality of data. And this data should be shared amongst different state agencies that require information. That was indeed, and it still is, a big challenge. That is sharing the information, for example, from the electoral authorities. As I said, this is still a challenge. Sharing general data of the population coming from census is indeed very valuable information. and we should be able to count on that. An important challenge is also organizing the public service and our staff. We must train our staff in technology. That doesn't just involve training of our own people, but it involves training people from other agencies and authorities. I thank you for being here. I congratulate ECLAC. During the last meeting, we talked about sharing our good practices, challenges, and opportunities. And this has been accomplished. And we are facing the same challenges, that's true. But we are in different levels of development, and that is why this is so important. We also receive support from World Bank and from IDB to share experiences and thus improve our system. We hope that soon this will be made even better. Thank you, Minister, for being here. Even though you're not feeling that well, so thank you very much for being here and talking about the challenges of digitalization, the protection of data, going towards interoperability. And very, very important is being more professional in the use of all of this data. This is going to be also stressed in our documents. Thank you very much for being here with us. I now give the floor to Ana Gabriela Sambiasi. Good morning, Ana Gabriela. She is a general coordinator of a registry process from evaluation, information management, and a single registry from social assistance and development department. From Brazil, Ana Gabriela, you have the floor. Thank you very much. Good morning. I'd like to thank the invitation for being here, and I'm here on behalf of my ministry. I'm very proud to be here. I ask patience because I speak Portañol, but that's okay. The single cadastre has many, many functions, but I will talk about the topic of this panel, and that has to do with the impact of digital transformation in social protection and what happened with the single cadastre. Let me talk about general elements, the single registry, digitalization, challenges faced after the pandemic. A single cadastre in Brazil. This is part of the non-contributory measures. We have universal policies, and that involves education, health, and social security. We have contributory policies, social security, labor, employment, and a non-contributory, and that has a single cadastre focusing social policies in Brazil. We have universal services, the single cadastre. It's a measurement to identify the socioeconomic situation of low-income families. This is really a map of the most vulnerable population in Brazil. We have more than 40 million families belonging to this list, more than 95 million persons involved, with an average of 2.3 persons per family. The families under this cadastre are low-income families. These are the ones that receive up to half a minimum wage per person. So this is how we target funds for these low-income families. We can also receive families with a little higher income according to special situations. We have in Bolsa Familia 21 million families involving 55 million persons. So this is a wider program because there is a wider uh, income level involved. Now, these are the families that are part of the system. This has changed after the pandemic. That is, after the pandemic, people became poorer. They, in turn, then became part of this cadastre. From January to February of this year, 1.6 million registries were updated, involving 354,000 newcomers. These are the families. In blue, we have families with income level of up to 218 reales, which is the poverty level. We can see on the right side that we have involved or made part of this the families with higher incomes as well. This is the form. It is in paper, but it's also in the system. There are 40 questions on uh, living, homes, gender, age, schooling levels, and these are social statistical data in order to compare this with the previous records.
The purposes of the register is to systematize the information on the most vulnerable population, reducing the invisibility of these families and allow an active search of persons who are unprotected and serving as a tool for intersectoral planning and connectivity. Not only assign benefits, but also detect vulnerabilities and give access to different programs. The main foundations is self-registration. Many of these families are in no database, they're not part of the formal market, and so the self-declaration is very good. But then afterwards, we check the information to ensure the consistency and any deviation of the information. The interviews are personal. At the moment, it's not possible to use an app for this. The family must go to the office of the single cadastre, and the municipal worker does ask the questions, collects the data, and the form is the same for the whole country. We train the professionals to do this and update it every 2 years. So if something changes in the family, we ask them to update this. But the register is considered to be updated every 2 years. And there we have a discussion with Costa Rica because this determines the volatility of income. So people join the labor market, they leave the labor market. And so we think the 2 years is considered as an updated register. And then we are looking towards integrating the register. Brazil is a very large country, and so this was a strategy by the government to have a federative compact for the register. And so the cadastre is in the 5,570 municipalities at local level, 27 federative units in states, and the national government coordinating this. It is a single system but with responsibilities spread out territorially. The registration process has to do with the identification of the public. The municipality knows how many low-income families are in the territory, and so they need to do an active search or identify the families. There is an interview and the data is collected. And the data is included in a system online, uh, the one for the whole country, and is being constantly updated. In the last month, it was 1.6 million updates in just 1 month. So here too, the cadastre implies a special register of the traditional groups that are divided into 15 groups, ethnic, environmental, situational, and so on. So they fill out the form in the same way, but it is possible to identify what sort of more vulnerable group they are part of for specific benefits available for these groups. They represent 11% of the total number of families in the cadastre, 4.7 million families. And also, we have 30 federal programs that are used with the cadastre to award benefits or have discounts in different funds or rights or social issues, infrastructure, and reduce credit rates. So, not only benefits, but also other purposes. And this is not only based on the income variable, but overall vulnerability. The cadastre can also provide other data that imply vulnerability, in addition to income. We have a process to verify the records. As I said, this is self-informed, but we must maintain the quality and the accuracy and the updatedness of the information. So this register is updated with others. And we check the family composition because in recent years there was an incentive to fragment the data on the families based on the cash transfer program. And so many families fragmented what we call into single parent families. So we check the family composition and integration with the database, which is the Brazilian database on formal incomes, benefits, pensions, and so on. And every year, we identify all records that have not been updated in the last 2 years, and we update them. The impact of digitalization began during the pandemic. Then at the time, there was a federal government financial benefit for the informal workers to ensure a minimum wage during the period of the pandemic. And also, the transfer was received automatically by the beneficiaries of the Bolsa Familia register. And so this institutionality is already well established in our social security system and enables the benefits be received very quickly and also the eligibility because we were able to have an integrated database with administrative data and work for 165 million families. And the persons who are not in the Bolsa Familia register or the single registration, we have provided digital platforms for some people to request aid because people were left worse off with the pandemic. And however, they were not in the single register, so they were able to do this using a digital platform. And so the beneficiaries were 68.2 million persons. 304 billion reales were paid out. That is $22 billion and 125 billion registers that were analyzed. And so, what was the progress made? The legacy of this after the pandemic. First of all, spreading the register to people who were not previously in the database. And then, in terms of the interoperability, there were many possibilities for the different government databases to be intermatched. More than 40 administrative records in analytical database. Technology and logistics for large-scale registration and processing of large volumes of information, all of this was made available. And identification of informal workers in this particular threshold and who are not in other systems. And also their bank information, because payment was done through the Bolsa Familia card system. And it is the federal economic cashier window. And they issued digital cards for these people to receive the money. We have a single registration system online, access to for all of the 5,000 and odd municipalities. It is not easy to have the data on all the families, but nevertheless, all municipalities are able to see the database very quickly after all the confidentiality agreements have been signed. And then this was done thanks to the participation of many municipalities and adapted to various municipalities. It is necessary to have transactions that are safe and tracked, and also it must be possible to integrate it, because in Brazil this is an issue. We do not have a single ID number, that whoever is born already has this number. We do have a registration of birth, yes, but this is a challenge for us. So we do need rules to unify people so as not to have a double cadastre in the system. And so also we consult others. So if a person dies off, there can be discontinued from the single cadastre so as not to have people receiving benefits when really they've died. Now, the single cadastre was a legacy of the pandemic, but we did have difficulties in opening up to register the people directly. The lack of digital inclusion, many people did not know how to use the digital platforms, they didn't have an internet connection, and also cadastral information is very patterned. So there was a lot of information that had been entered incorrectly. So it was quite a process, challenge, in order to ensure the quality of the information being keyed in, and also because the single cadastre as an instrument of social assistance is important, that it be done in the office of the family with a surveyor and the social assistant, because in this process to collect information, it is possible to identify vulnerabilities for the services. So there is a challenge in terms of using digitalization, yes, of course, but how to make sure that these families are not excluded from the services later on. Now, another thing was the integration. This is also a legacy of the pandemic. We are now pooling the information. That is, we cross-match the data, the single cadastre, with the national social information cadastre, which is a register with 80 million date of birth, date of death, identification of person, formal labor contracts, assistance, and social security aid. So everything is uploaded. We cross-match the information, and then the information is already part of the single cadastre system. The families do not ask for any further information. And if we have 18.5 million people in June last year, then 17 in October, now in January 5.9, and with this entire process, there's been canceling, immediate canceling in the Bolsa Familia on account of inclusion errors, people who should not be getting benefits. And this opens up a space for for the families that do need it. Now, the next step is to have an API, which is an integration done online. You don't no longer need to have a summary of information. But so now we're embarked on this process and we would like to do it this year. And also this year we have data tools being developed. And so the digitalization of the information and making all of this visible for planning based on the vulnerabilities and enabling public policy. We have several tools for that. The newest is the Observatory of the Single Cadastre. And the idea is that it be also a system for focusing benefits because the system does not have the benefits. The benefit systems are separate, but we are already seeing this, such as the BBC, which is our pension, non-contributory, and Bolsa Familia as well.
The last point to conclude, we have this combination of digital strategies with the face-to-face service channels, and to do this with a coordination, because otherwise the catastrophe will not have a quality follow-up to reinforce the capabilities of the states and the digitalization process with the single records also for the databases. We have to deal with the education, the health, the prevention of catastrophes and the climate emergencies. We need to um, improve the capabilities of this application in terms of transparency and to conduct the diagnosis. We also need to do the campaign of public information. There is a lot of confusion today between the single cadastre and the family um, income, and in order to do this through the applications, we need to reach the most vulnerable sectors, and now we are excluding the inclusion bias, and we want to include the most vulnerable groups, and we use also the intelligence of data to reduce the systemic frauds, because in Brazil there are many incentives to do fraud. And we are tackling this through the technology, and we're working with the people from the intelligence area to reinforce this policy of assessment and follow up. Thank you. Thank you very much, Ana Gabriele, for your presentation. This is actually a very powerful tool, and we should highlight the process of innovation to expand the coverage and this pathway you are going through now to improve the innovation as the digital application with all the challenges it includes without replacing the face-to-face activities with the different workers. And this is very important for Latin America. The fact of having the single identifier, I think that this is of paramount importance for the future of social protection development. And now I will give the floor to Paula Poblete. Paula Poblete is Undersecretary of Social evaluation from the Ministry of Social Development and Family from Chile. The government of Chile is presiding the conference for the social development conference, and she is representing in that capacity too. Thank you and good morning, everyone. Thank you very much for this invitation to participate and to share our experience and to learn at the same time from the other countries. I have a decalogue that I would like to share with you regarding our register of households. This started in 2016 and it is originating taking advantage of the technological advances and the access to internet that allowed to leave behind the characterization process we had beforehand that was the social protection record. So as a first point, I would like to tell you that this record replaced the use of data that were self-reported by these administrative records, and these administrative records were available thanks to the technological breakthroughs that we had in the private and public sectors. So we used the records coming from the labor, from the different areas, and that are captured by the internal revenue service, the superintendents of health, the administrator of retirement funds, and the Institute of Social Security, among other institutions. At the same time, the income, effective income earned by the participants of a household are um, linked to other information related to the lifestyles of people. For example, the properties and the inscription in private schools and so on. When this started back in 2016, we had at least 90% or 90% of the household we had at least one person who was registered in these administrative records that we had available at the state level. Obviously, we also face the challenge to characterize properly the people who have a high level of informality at labor and also for the property of their properties. And we all need, can count on this self-reporting. And therefore, these households are included in the system of household supervision, annual supervision. We have 30% of them that have self-reported income. As a second point, I would like to tell you that this change of model, that is to say, transiting from self-reporting to the administrative records, allow to change something from the basis. Beforehand, we evaluated the income generating ability of the people, and now we are analyzing the social and economic vulnerability of the people at households and the access or the access to the real data observed of quality that can be confirmed and predicted allow to change this model and not sanctioning people who had a schooling level higher to the average and were unemployed. As a third issue, I would like to tell you that this change was possible largely because our citizens had increased access to internet. Back in 2016, although in some specific populations it's different, we have gaps at the digital level. But in 2016, we had a young population that had been trained at the schools during the 90s in IT. There was at that time a political decision to do so, and therefore the household information system is offering for the first time a platform where people could interact, to observe their data, to ask requests automatically in a personal manner. This allows people to see the data that the state has about people and to update, rectify, or complement part of that information. This allows to serve the people vis-a-vis their personal data, and also the administrative records could be updated because they had some errors that should be mended. I would like to tell you that during the last 12 months, 74.4% of the requests are uh, done through a digital channel. So that is the degree of digitalization of service at the social records system. In Chile, we have more mobile devices connected than inhabitants. So for many years, that is the ratio we have in the country. The access to the internet through the cell phones made that right from the beginning, the platform had to allow um, suitable visualization of data. I can tell you now, 71.2 of the accesses to the platform has been carried out through a mobile device. That is the penetration rate. As a fifth point, I would like to tell you good news. Good news we have, unlike what Brazil told us. And this has allowed the integration of all this data. In Chile, we do have a RUN, and that is a national identification number that is unique to each one of the inhabitants, and this exists for 99% of the population living in the country. This is given at the birth time of when the migratory situation of the migrants is formalized. And from decades now, all the administrative records should use this number as an identifier, and this makes possible to have a comprehensive, complete data about these issues that are then used in the system. As a definition of the design, um, the The social record for households is available for anyone living in Chile and has this national ID. In 2024, it is composed of over 9 million households and 17 million people, over 17 million people, representing 86% of the population in our country. As a sixth point, I would like to tell you about another advantage that we were able to identify in Chile concerning the functioning of these social records. We have in Chile what we call the as unique key or identification, which is digital identification for people over 14 years of age. And this can be activated after face-to-face identification at the civil register. We have this kind of national ID, which is digital. In 2016, when we started with the social protection register, we had just low number of people who had this information, and during the pandemic, many of people requested this number, and today over 50 million people have this um, password, and people have to identify themselves at the gateways with their password, and they can do many procedures online, and this state at the same time has a certainty about the people who are doing these procedures, and they can have access to some information of the members of the household. The people have a limited use of the data about other parties. As a sixth element, I would like to say that in different fora, we have express the risk of the data quality when people have direct access to the platform to do or requests for change. And we would like to point out that in the case of the household social register, this has not instant effect. There are some protocols for the municipalities that should be requested to people before these changes are validated. And a very important part of this model is based on administrative data and allow it to collate that the elements that the people are submitting or the requests that people are doing are in line with the registers from different institutions. Now, there is a weak point or a challenge for any system of household registers or records. The makeup of the household is always self reported, and I would say that it is a major challenge we're facing in the Chilean case. During the pandemic, and due to the different benefits that were granted, some incentives were for the division of the households, and today we have an real ratio of one person household in the records. When the requests were done through internet, it was easier to do this request, unlike when they were compelled to do it in front of the municipal officer who was an expert to have the mechanism in place in order to verify and make sure that people were showing their real status. As an eighth point, and it has been alluded in the previous presentation too, I would like to mention the challenge of interoperability, that is to say, the capability of the institutions to provide the data and to use the data from the records, because this ability depends on or this possibility depends on the technological capabilities of each one of institutions to process the data, to provide the API websites, and to serve a high number in a short period of time because of this volume of consultations.
This improvement is part of the efforts for the law on digital transformation in Chile, which makes it mandatory for agencies to implement the system so that in turn people don't have to once more provide information that already lies elsewhere in other agencies. Our ministry does have the technical connectivity that is needed, and this is indeed provides services required. A challenge that we find here and that is found in all the countries as well comes because of the way our territory lies. We have a long country, some areas are of difficult access. We provide options for these persons to have access to the registry or to give in their data. There are municipal efforts whereby people from uh, the local governments travel to these faraway places. We do have another challenge that is a strategic or political one. Here in this country, people or families do have a certain level of vulnerability. Many families find it difficult to reach the standard of living that they would like. They feel that the state is not providing their needs. This is a perception coming from many families. Public policies usually focus at the 40 or 60% poorer families. Many households, therefore, are out of this focus. This, in turn, creates this feeling of injustice. In order to change this perception and to go towards a more equality, we wish to protect or improve our social protection system, meaning that there should be some minimum uh, assistance for these families. Besides, we believe that we should uh, explore different mechanisms, not just considering individual families, but having in mind, for example, territorial vulnerability, thus going forward into a supply that would provide universal assistance as we do here in Chile. Thank you for your assistance. Thank you, Undersecretary, for bringing us this presentation on your country, Chile, and in showing what are the main challenges that you are facing. Looking also at what can be strengthened, what could come about in answering the emergencies or disasters that we have had to face lately. You yourself said that there have been these tremendous fires in Villa del Mar. So we thank you for taking time to be here with us. You've talked about the administrative records, which is key information for social data. And the other interesting thing has to do with validation. And this is very important in order to have a more participation and better governance. Thank you so much, then. And we hope that you will continue sharing all this information with us. We now give the floor to Hector Cárdenas from Paraguay. Hector Cárdenas is executive director of the technical division from the social cabinet of Paraguay. Thank you. I would like, first of all, to thank Hector for the invitation to be here. Now, I will talk about what's happening in my country. We coincide with much of what has been said here. And it's a great opportunity to learn from other countries and thus go forward in the implementation of the social programs, especially new protection policies. Now, SIIS in Paraguay, that is the Integrated Social Information System. This is a tremendous series of institutions and programs that are united into this SIIS. The system has a module with available public supply. In this information system, we can also have access to information from other institutions. And I will talk about this later on. There's a new decree that came about 3 months ago. It makes it mandatory that other benefits be provided. We have to have a, we don't have to have a registry of additional benefits. It's very interesting having a single registry. This decree also talks about the beneficiaries. The institutions already do have uh, this mandatory obligation. Within the social protection system, there are persons who are connected with the economy ministry. So progress has been made this. They're in monitoring budgets, and there are other modules involved in this. Now, the idea is that this is a tool for the appropriate implementation of different programs having to do with social protection. SIIS also has access to other databases. For example, the social registry of the population with information on birth and deaths. This must be an active registry. We also have information on the level of education of persons, and that comes from the Ministry of Education. We have information on employment, on social protection, and there it's important to see which of the workers contribute for their own pension, which workers have contract, which are independent or informal. And this may also be very useful for guidance. There are simple files on citizens, and this then in turn provides all of the information, and this is supplemented by administrative records. Now, in talking about public information, we hear about the programs, who has access, and how is that related to other ministries. Let us now take a look at challenges. During this digital transformation, the initial challenge has to do with a single file, because we know that different institutions have their own information, but the idea is to go forward into a single file that will be available to all institutions, shared by all institutions. Here we have a module that brings in interoperability, and this is used by all state agencies. Somehow, we do have access to some of the database, and we use up that information, but it is difficult for other agencies to provide their own information. Maybe we can ask for the information through a pen drive, but that is why we have to go forward here. Public supply. We must have the whole information updated and complete. Some programs change every month, others every 6 months, others are annual. So this is something that must be constantly updated. That is another challenge we're facing. In order to follow up the programs, we must be connected through web service, and that makes us get in touch with the Ministry of Economy or Finance Ministry, who does know about the budgets. Social records and digital transformation within social protection system in Paraguay. Here we have different challenges involved. Well, we've already talked about the need for a single file. this is something that must be implemented. We must get all of the information from each program, and this would in turn go to become a part of the household registry. And this is no longer done in by paper, but we are digitalizing much of this. During the pandemic, as occurred in other countries, we found ourselves with an opportunity to digitalize our information on the internet and through self information. We were able to obtain more information from different families. There's another way to get this information, and that is through the institutions. So we're going forward into this interoperability. We have done a lot, but much still has to be done. The household registry has all of this information. It has an algorithm that is used to classify the population into six categories. In Paraguay, we are looking at the multidimensional poverty, and there are state organizations that in turn use this information. Now, at SIIS, we created a single participant cadastre. I remember that I showed you the little maps, and that is where we have public supply and the territorial benefits. Now, we are already making headway in different reports. Here, Darshwart, these are terms that are used. We are able to analyze this information per department, per municipalities. The idea, though, is that the information be expanded because what we have is still not enough. We were calculating that about 90% in Chile is self reporting, but in my country we're at 60%. But there are other programs that are not updated. We also have interoperability. These are big challenges. But we are clear that we must take advantage of data science and the progress reached in other countries. And we're working together with ECLAT to be able to count on some technical support. And I was talking to the delegate from IDB about the group that is being set up. We're talking about 10 or 11 countries that are getting together, and that's a new opportunity to learn from others.
And so, data mining, a lot of things there that we can make the most of. And we're hearing the experience in these countries where that it is possible to move ahead. The issue of the big data, business intelligence, artificial intelligence, data warehousing, computing, all things that can be used, but we need to take the step towards that. Thank you. Well, thank you very much, Mr. Hector Cardenas, for having shared the progress made and the challenges ahead and our dialogue with other countries. It is very important to see the systems, and this is comprises not only social registrations but other information that is of key importance, such as the social program, policies, and who's receiving the benefits. And so This is very commendable how you have been doing all of this um, and challenges that could be put on that area. And all the colleagues that are in the panel, we thank you all very much and very welcome. And so now we will move on to the discussants, and we ask you to please do it. We're running very late, but nevertheless, the everything is very valuable. And so I am pleased to begin by recognizing Luis Tejerina, Lead Social Protection Specialist, Inter-American Development Bank. Please, Liz, the floor is yours. It's a pleasure to have you here. Well, thank you very much, and also ECLAC and BMC. And it is a luxury to be part of this panel with the participation of all these countries and these excellent presentations that we have had. I hope I am at the height of everyone's expectations with my comments. And of course, on the one hand, we have a region here that is particular. Yesterday we saw data, global data, and I think it is important to highlight some data of the region. This is ECLAC data. Countries that have registers on average 57% coverage of the population. So pretty high, not sufficient, but pretty high. Obviously, very heterogeneous, but 50% percentage of informality and more or less 55% coverage of poor households. So some of these figures for the region, I think, vary a lot from what we see at a global level, and that leads to certain specificities when we're discussing the social registers and the cost-benefit of implementing social registers. I think it is important first to speak of the possible gains in having these social registers. And I think it is important to take away from this emphasis of just classification. It is important, yes, it is useful, yes, it is key, but it is one of the functions of having a register of this type. During the pandemic, for example, we found data. We were speaking of the overall institutional capacity, but these registers did help countries that had the systems to react more quickly. Maybe not to decide to do something or when to do it, but yes, the tools to be able to act. And something that has not been mentioned that I believe is important is the value for accountability. That is, even if I did not have added value, if the added value was zero in improving the focusing of aid, I think it is important to have a register even after the crisis to say, look, here, this is a register of who we gave help to. They went to these people in these areas, and you can check it. And so that is one of the things, one of the advantages of having one of these systems. In addition to acting quite quickly and improving focusing. And also in the benefits that we were taking a look at tend to go beyond the poor households. Why? Well, because we have demographic changes, and I believe that qualitative changes in the region that are going to make things more dynamic. So, what 20 years ago was a program that saw structural poverty, and there was a fairly sound group of poor homes. Today, it is more dynamic with people who come go and get into the segment or out of the segment, and they and so the situation is far more dynamic, and for which we need information systems that go beyond the merely poor households. And also in the region, we're seeing migration, and so we need household records, not just the social record. And the idea is to use technology to improve the way we're doing things. See, some of the examples we saw them now, but others are examples of other countries. For example, the use of geospatial information in order to find the households that could be invisible despite the interoperability, but sometimes they're not in the administrative databases. And what households? Well, say those that need even more support than the others. And so the idea is to use technology in order to identify these households. We found them in Costa Rica, in Ecuador, the use of satellite imagery. And the other thing is the use of technology to support issues related to shocks, say climate change. For example, mapping of the more vulnerable areas to different shock types, and also identifying the households in those areas to be able to reach them and have updated information. And also to support the identification of needs to extend the type of social services. Could be pension, health, or in the case of Guyana, for example, where we're using a mapping of the population with the mapping of the windows where people can cash in their contributions so that the elderly people should not have to travel great distances to cash in their pensions. So there is quite an array of new uses of these information systems, and that must be taken into account when you're thinking of how to invest and how much in these systems. There are risks, of course. There are risks, and I think that the umbrella of the risks are between sustainability and accountability. I will go through this quickly. Governance. Governance, we've seen progress in the region with laws that help protect information. And so the information on people is far more legally protected, but not necessarily at IT level. But when you improve the quality of the information, you make it more attractive. And so this must go hand in hand with investments in security, cybersecurity, that often goes beyond just one ministry or a specific register. You need to have improvements in security at national level and ensure also the services among institutions. We did analysis and we saw that many institutions were not so much depending on the services they could have in cybersecurity and these ministries of national security. And a key issue here, this is a key issue, because when we take a look at sustainability and we're talking about financial sustainability, in many cases, interoperability must be one of the channels that helps us to reduce costs. Is not to be investing large sums in mass collection of information. And households, the most vulnerable households, vulnerable to shocks, usually change and update their information, their phone numbers very frequently. So if we have a database that has data 4 years back, quite likely half of those people will have old phone numbers and keyed in. So how often should we update it? Every year, every 6 months? That's not easy. And so interoperability, yes, but at the same time, the use of data to prioritize what households we need to provide certain services. Some households are going to be more vulnerable to external shocks quite frequently. And then also we have the issue of sustainability and architecture. All of that is related to changes that we've seen in the last 5 to 7 years. Because there are changes that are occurring in how institutions invest. And one thing that we were talking about yesterday in our digital team is how we are changing physical investments and inside technology purchases. And it's more investments in investments as a service. So I no longer buy the server or the software, but I simply go paying a monthly amount. And that has implications, fiscal implications, because before I buy it, it's a one-time purchase. And I had to do maintenance. But today, this becomes an ongoing bill. So what happens if I have liquidity issues that interrupt those payments? And so the way of thinking of changing investment changes, and this requires a new way of addressing the financial planning of what we spend in these systems. I'm thinking of the cloud. How do I budget this? And what happens when if I don't have the money to pay for the cloud in a given month? And then inclusion. And this is also very important, linked to interoperability. With interoperability, we can improve coverage. Costa Rica, they were able to increase the coverage of their social registers very efficiently. And Chile also, well, they've just explained it. The example of using administrative data to obtain updated information, and that in turn reduces costs. Not all countries will be able to do that, but having a gradual movement towards the improvement of administrative databases and interoperability. And so the challenge, I think, is not technical. No, that part is easy. The difficult part is the shielding, the legal shielding, regulatory shielding to give the officers the peace of mind that it's all right to share that information. So it's the technical backing that if I share my information with someone, that person has the ability to protect the information. I will not breach the information. So it's an entire umbrella that has to do with interoperability, but it is a key issue and that has to do with the coverage and the sustainability of these systems. Inclusion. Inclusion is very important. This has to do with not only going to remote areas to capture the people who are invisible in the system.
But this is also related to disabilities. In many countries, they have used systems that are for self-inscription, and we see that many countries try to do it right now on the digital platforms. And we conducted a survey that gives an idea. And we saw that half of the households we interviewed had a clear idea for the design of platforms so that they can be inclusive. Once again, I would like to highlight something. The Cirenove, they have our website for people with different kinds of disabilities. And this is very important because during the COVID, there were some data compiled that showed that people had problems for self-inscription. People with disability had problems to use these platforms for self-inscription. So when we use them, we should try that they are inclusive so that digitalization is it's not a new way of exclusion. We have some examples of institutions that are doing this very well. I think that this entails risks, but these risks can be solved adequately. Now, concerning the updating of information, we see many countries that have this trade-off. It is important to have the updated information, but it is expensive. So how I do this, how I tackle this to get the optimum out of it. For example, it should be for 3 or 4 years. We see that in Brazil they do it for 24 months. I don't know if all the countries will be able to have the financing for 24 months, but in the Caribbean, it's easier to do it with the updating of the information. So I think it's very important to think not on one size fits all, but we should set the priority and to see where we have the updated information and to save costs to have this updated information and where this information is more urgent for the households that are poorer. Maybe we don't need the information that is updated so frequently. Finally, to guarantee the use of information, the sustainability of the system depends on the usage we made out of them. If we have a system that is costly and we use it only for the classification of households between poor and non-poor, we are going to say that maybe it's worthwhile to invest in these systems, and we should create this analysis of the information, which is a key factor, not only creating dashboards, but to create a capability to pose the right questions. So the right questions depends on the generation of the institutional framework and the staffing. Not only having the ability, but the time and the mandate to think of these issues. So that we can come up with the information that will feed the decision-making process in an optimal manner. This goes through technology, but also through the institutional part of incentives and human resources with the time and mandate. The sustainability of this depends on that, and that we can tap the best out of it. Thank you very much. Thank you very much, Luis, for your comments. That will be very important for all countries. Now will be the floor to Luz Estela Rodriguez, Senior Specialist in Social Protection from the World Bank. Thank you. Thank you, Claudia. I would like to thank ECLAG and the German Corporation for the invitation. It is always a pleasure to come back to Chile. As you have all said, all the panelists had already expressed it, and including Luis, and they have alluded to the main points I wanted to discuss today. But as a reminder, I would like to say that the social registries are systems for information and for inclusion. We shouldn't forget that. They are the gateway to benefits and social programs, but they are also very powerful tools in order to do the tracing of all the benefits, social benefits generated in different countries. They are of paramount importance for what we were discussing yesterday. That is to say, to think of this in a comprehensive manner. How I link this social security, social protection, the active policies for labor, and this allows to do the traceability and to link the interventions together and to see where we have the gaps for further interventions. Another important theme for the World Bank is to define not only what the countries require, but how. It is very important to define how we can improve the service to the beneficiaries, how we can render the systems more efficient from the position of the citizens, and this helps to give a better service to the citizen, to connect them with the services and benefits, and as I said before, to follow up the impact from these interventions. The social registers are not only important for our social sectors, but they are part of the wider structure. They are connected to the registries of identification, they are connected to the payment mechanisms and the platforms of payments that are operated normally by the Ministry of Finances and a series of databases. And that's why they are accorded with a major power. That's why we expect to see them from a higher perspective. Beforehand, they were considered as a registry for the poor, but now it's more universal. Universal. This is also depending on each one of the countries. For example, maybe in Brazil, they cannot have these comprehensive systems. So we need to work in these social registries that are more integrated, more dynamic, with updated information that are robust, which is very important to reduce the operational complexity of the programs and to let not letting the programs working in a silo, but in an integrated dynamics, and that the user do not have to pass through four different stops, one single stop. So Definitely, we need to improve the experience of the user, understanding that the user has time restrictions and doesn't have the time to go from one office to another for the social protection purposes, and that they benefit highly from this integration. It is important to remind that during the pandemic, these social registries had some very important innovations, and this is one of the silver lining experiences. These allow to include innovation and to connect many things together. We had legal mechanisms that were exceptional or extraordinary that allowed to link data together because this is one of the major roadblocks. That is to say, many entities cannot share their data because of privacy issues. And this allowed to reach what we call the missing middle. That is to say, the population was invisible before, and that we were able to identify through the social registries. As Louis said, uh, during this pandemic, we saw major problems to contact people because the poor and vulnerable population is highly mobile. That is to say, they are changing from dwellings, and it's very difficult to identify them. And as I was saying, is another important thing is the data exchange. Starting from all these reflections that were provided by the five countries, I would concentrate the messages around four main pillars. First of all, we need to reinforce governance, not only in terms of the legal framework, but also the institutional framework. How do I achieve that the institutions are strong and have the technological means to operate and that they are connected to the rest of the technological infrastructure that make part of the public scheme? Because the role of the subnational government is also important, that it should be connected to the national registry. And this means to determine the financing because many of them have problems to have access to the resources and operate nationwide and to coordinate the interactions. The second point is connected to the promotion of interoperability, as it has been alluded to widely here. And the interoperability should help reduce the costs for the state and the citizens. It can uh, make things possible, such as integrating the social registry with the infrastructure of payments from the treasury. And this allows to reduce costs for the state to improve the problems of inclusion and exclusion. And additionally, it allows the beneficiary to decide where he wants to get paid. We should continue to promote the interoperability and thinking of an ecosystem that is larger than the digital public infrastructure. Another point that was raised by Mr. Yanez is increasing the volume, increasing the coverage rate, and always thinking of the context of the country itself, because not always more will mean better, and sometimes it's very unlikely to have a very wide registry. But the important thing is to compile information of quality, that the process of information compilation is validated, that they are updated, and finally, that they can be used. That is a fourth point that I would mention. Creating the install capacity not only at the unit of a social registry, but all around the different institutions and the academy to use this information in different ways. Finally, I would point out that we need to create a new relationship with citizens. There are many myths around the social registry. So some people try to hide, to conceal information, but we need to reassure the user that they can provide their truthful information and that the citizen can also know what kind of information the state has, as I said in the case of Chile. This transparent process is very important, particularly now with this new development of service points for the client or the beneficiary. We need to highlight the digital issue, but we should think that there will be a that segment that will not be reached, and we should reach them with different mechanisms. We shouldn't forget that the citizen is always the um, end point. And we should consider the speed, willingness should be considered. Thank you. Thank you very much. Thank you, Luz Estela, for those comments and the fine points you raised. And I will give now the floor to Maria Palma from the Social Development Division at ECLEC, who will wrap up with the final comments. Well, thank you, Paula, and it's very difficult to start after these experts' presentation. I would like to thank myself, listen, the people who accepted the invitation to participate in this panel and to have this rich exchange we had around the social registries. As Paula said, I am related to the digital issues, and I would like to speak a little bit about this challenge for the digital social protection. In general terms, the challenge we see for the social uh, policy and the digital transformation. The digitalization is now invading all the areas of action, and this is unveiling also the access to internet. The use of internet is massified, and we have high rates of access to internet in the region. As the Undersecretary Poblete said, in Chile we have more than one cell phone by inhabitants, and in other parts of the region. And the access to these devices is allowing to have more people connected. And if we go beyond this issue of connection and access, we can realize that there are some other inequalities. And here there is the concept of significant connection. When we speak of access to the internet, it's not only the possibility of being online, but the quality of that connection, the speed, and the device from which I will have access.
During the pandemic, for example, having access to education or health services through a phone is different from having access through a computer or a tablet. I'd like to talk about the digital inclusion. We have already talked about social digital inclusion. How can these be connected? When we talk about access, indeed, we're talking about the possibility of having access, of getting connected. And this entails having the necessary infrastructure, as well as the capability, digital capability, and other things, so as to have access to internet. A region, for example, with uh, great inequality, it's important to know about the role of digitalization. As we heard at the beginning from Alberto, social protection's future is to be uh, changing, and there are new risks coming from digitalization. We yesterday heard this from labor working through platforms and the rights involved. Alexander said that we should no longer think about social protection, only from the standpoint of poverty, but also from the perspective of rights. There are rights in the digital world. It's a big challenge to see which are the right to privacy, the right to communication, and this comes from IT. What are the rights for the whole of the population, and how is this going to affect the social protection policies? This involves different kinds of rights, social, cultural, economic, and this aims at improving the quality of living of all, because many will be affected by digitalization, and this also has to do with the well-being in as much as we enter this world and have the possibility to truly participate. There is something important in the use of digital tools. Digital platforms were created in the private world, so they respond to private needs and the search of private benefits. So how can we then get a hold on this from public spheres so that this digital world may also respond to people's needs? I'd like to ask all to think about the social compact and how digitalization is related. We have talked about the three rights, and these rights are being affected now in the digital world and in the social registries. We have to think about protection. We're not thinking about a cop out in the streets. No, we're talking about making sure that our information that is online is equally protected. And this has to do with social policies, public policies, and privacy in all our information. When we talk about big data that is being processed, we have information from people under certain conditions. We have the development of protocols and care, taking care of the information. There's something very important that I'd like to mention here. Luis and Estela also talked about this, and that has to do with the infrastructure and investment that is needed to care for this data. We're not just talking about hardware and software. We're also talking about skills among the staff that manages this information. They have to have the digital skills in order to handle this tremendous amount of information. There are many studies in talking about the digital exclusion, especially under social protection. We know that the lack of access to ICTs makes things even more uneven. Digital exclusion means that they will have less access to social protection, and this may give rise to intermediaries that may try to exploit the situation. We have to be careful about this possible risk in implementing the politics and going forward into more digitalization. I don't have time to bring to you everything I wanted to, because otherwise we would be here until 2 p.m. No lunch. But I'd like to reinforce the ideas. Digital inclusion in time. Information that is online is limited to people that have access to this technology. We have to see how this information is being used through algorithms for the selection of the population. And as much as this information already has a bias, we yesterday heard about the information in gender, and there's a bias there because we have less access to technology, differences in coverage. So how can we get the information to be devoid of this kind of bias. This could bring in discrimination in the use of algorithms. I'd like to close by saying something that I think is key. One of the main challenges that I wanted to uh, tackle in my presentation and to bring in something different, and that has to do with the fact that technology should be centered on persons as well as AI. Human beings should be the subject to do things differently and to come to outcomes according to their circumstances. Digitalization so things can be made faster and cheaper. We're not just talking about managing social protection information, but offering services so that the result may be more efficient and timely for the benefit of the population. Thank you, Amalia, for this excellent intervention. And now we thank Minister Castillo, Leon, Ms. Cambiase, Paula Poblete, Undersecretary Hector Cadenas, and our excellent discussants, Luis Tejerina, Luz Estela Rodriguez, Amalia Palma. Thank you all, and with this, we are going to close this panel. We wish to thank all of those who are present with us from streaming means and for all of us, all of you who are here physically present.
Volvemos a la hora prevista en el programa, por favor. Gracias.
Yo no creo que estén en el hotel.
Sí, le puede matar el formato. Vamos.
Hello. We're going to wait just a few additional minutes to wait for the rest of the people. So I will ask the panelists to wait for a little longer.
Buenas tardes a todas y todos.
Good afternoon, everyone. I would like to invite you to be seated so that we can start this session for the afternoon. As my colleague Carlos Maldonado said, this is the typical session, and we'll try to keep you asleep after the awake, sorry, after the lunch. And thank you very much for participating in the session number 7 of this session, the International Program of Social Protection Latin America and the and we will deal with the main factors for the non-contributive system in Latin America and the Caribbean. And we expected that the panelists can delve into these issues and the monitoring and assessment of the policies. The idea is to reflect on the programs of social protection in the region and the advantage that this entails for the design and evaluation of social policies and the challenges in to have this information available timely. I would like to give the floor now to Ninsen Figueroa, our colleague, and he works here in the Division of Social Development at ICLAC. Vincent, you have the floor now. Thank you. And I see this as a problem because 2 days in a row I had to present after lunch. So I think that this is a common factor in my case. Yes, I set up the agenda. I negotiated to be participating at this time. As Amalia was saying, I will present on two things. First of all, we'll speak about the non-contributing social protection system in Latin America and the Caribbean. We are going to focus mainly on the origin of this information that we use at the Division of Social Development. And this is part of what I'm going to present here now related to the database of the non-contributing social protection system. And we have records that are administrative. And based on this information, we conduct the assessment for the coverage and investment of the non-contributing social protection in the region with a number of countries, some 21 countries, and I will give you some details about that. So the content of the presentation will be about the theory, and we'll land the discussion we had in the previous sessions and the administrative records that we have for the monitoring and evaluation of the non-contributing social protection programs. I will show you the database that we have for this objective that is fed from the administrative records. I will speak about the methodology we use for the expenses and coverage and the lessons learned from the analysis of the administrative unit we had. Before the presentation, I was talking to Leonel Vargas, and I will say that it started by 2015, but he was the first person to participate back in 2012. So the information that we have starts over 12 years now when we started to systematize the information. To start off, we have observed that in the last decades, the information of the administrative registries has increased in the monitoring of the social protection programs, and this is because of the exponential growth of the data that have been accumulated as a result of the technological changes that allow us to store and transmit, convey information that is very complex. As a matter of fact, in 2020, after the pandemic, and based on the estimations of United Nations, 64.6 zettabyte, where I didn't know what a zettabyte was, but it's approximately 500,000 million iPhones of 500 gigabytes, or the equivalent of what we here. This has been produced during the pandemic, and it is supposed to be increasing in 314% in terms of information. This has transformative impact in the decision making from the administrative administration and the implementation of the social programs. This is a valuable instrument to understand the needs of the population, evaluate the efficiency of the interventions, and to earmark the resources as we spoke in the previous panel. In this respect, the countries in the region have different sources of information so that they can feed those programs, the social programs. These are data coming from the administrative registries. And what are they so that we speak a common language from here on? First of all, they are data or information coming from the functioning of the administrative systems of the countries, and maybe they satisfy the requirements, regulation requirements between the institution or inside the institution. What we see is that this compliance is inside the institutions. For example, some time marks when the people are um, cashing their benefits or registries in these websites, and they are the result of the operation of the programs and not data for recollection for research purposes. And these records are crucial for the evidence based research, particularly for the decision making that is strategic for the government to understand the dynamics that are evolving as well as the emerging needs of the participants in each one of the programs or from the citizenship as a whole. They are fundamental for the decision making based on evidence and offer many advantages because they are an ongoing source of information depending on the infrastructure and the level of capabilities that the institutions have in place to deal with this information. This allows to have updated data on a daily basis, a monthly basis, depending on the system about the target population. And additionally, they offer data at that larger scale and a cost that is relatively low. And they present the data that in general terms as compared to the collection of self-reporting is face-to-face or through wave, and they offer a higher degree of trustworthiness and trustworthiness. And we can exchange this information with the institutions, and this allows to have more reliability about what we are doing in the different countries. Additionally, this was discussed yesterday in the case of Slovenia and the previous session. This also fosters transparency and accountability because people can have access to the information. They know what the governments are doing in terms of coverage, expenses, and a series of issues related to the contributed social protection programs. The invitation that we are doing from the technical core is to think of this data as public goods, to know how the social, non-contributed social programs are moving ahead, but also to know to make them available to the citizenship. And this information has allowed the responsible and the decision makers to adapt themselves to the emerging situations and to make an informed decision. We have, for example, the history of these, the use of these data to provide the benefits to populations who needed that during the pandemic or different crises that we have undergone. And these registries have been fundamental to reach the most affected populations by crisis. We are going to discuss this point later on, but we have encountered some difficulties for the invisibility of some of the populations, and this would allow the countries to adapt rapidly the programs already existing in order to meet the emerging needs of the population. In the particular case of Chile, where in the case of the fires we have lately, in other countries like Dominican Republic with hurricanes and other disasters. We have these advantages that we have referred to during these 2 days. Nevertheless, we have some challenges, particularly in terms of administration and use of data. As we said before, there are some problems of integration of data from different sources, from different institutions, and in general terms, the institutions of a state or a province are reluctant to provide the information as a result of the normal doing of the institutions or as with issues related to privacy. They don't know what is going to happen with the information and the security that is provided. There is also difficulty to update the data and the need. And this is an advantage or a disadvantage that we observe in some countries in Latin America or in the whole region regarding the specialized skills that are required for the administration and understanding of the complex data coming from these administrative registries. And another thing that we observe is the protection and security of data. That is to say, to observe the principles that the institution has been mandated with for the non-contributive social protection, but this supposes also the protection that people are entitled to. Well, how do we tackle those challenges? Mainly, as we were discussing beforehand, this requires political willingness, not only technical skills, the development of software and hardware platforms, and direct communication channels among the institution and with the citizens. The information that is provided to the citizens so that they can cash their benefits and to know what the institutions are doing. Here I summing up the factors, but there is also a need of investment and collaboration in terms of technology and training of the staff to increase the use of these administrative registries. It is vital to foster the integrity and compatibility of the data. It is already useful if we have these or it's not useful if this data cannot dialogue and if we don't have the ability to transfer this information to the social registry. Another point that is not negligible is promoting the standards of transparency and comparability, allowing to know the progress of the non-contributive social protection programs. That is to say, what countries, what social protection programs are at what degree of development in order to help with the technical cooperation or other issues. The commitment by the countries and the authorities and the institutions is fundamental for the consolidation of these programs of social protection, right from the production of information in order to measure the progress of the consolidation of these social protection programs to establish the standards for the non-contributive social protection schemes. I would like to point out two dimensions in this regard: the information about the progress in coverage and the investment for such programs. What we should do is moving ahead with these standards for the public spending, allowing to inform the citizenship about this progress made, and allowing at the same time the institutions and the country to know the status that we have for the social protection systems with an approach of open data. This is fundamental. It's not useful if the platforms are closed or static and do not allow to dialogue with other platform or to download the data. And the main thing is to have the protection of privacy and access to information. The countries in general terms are mandated with some of the institutions to provide this information, but it doesn't mean that the information about the people who receive this benefit is disclosed. And now, regarding the comparability of the system of social protection, the social protection division at ECLAC is systematizing the information about the programs of non-contributing social protection schemes based on the program for the subject in Latin America and the Caribbean. This is the database that is consolidated based on the administrative registry, and we will further develop or discuss these issues. As I said before, although this is a response of the mandate the countries give in the Conference of Social Development in 2050, It is an exercise that is carried out beforehand by 2011 or 2012 to create the information. That is to say, the database already existed. And what is the mandate to the countries is to organize and systematize these database to know what is the information contained and to do the compared studies for the social protection programs offer. And presently, these databases contains information from three lines of programs related to the condition transfer programs with 55 non-contributed pensions with 36 countries and 42 programs and programs of labor inclusion from 42 countries. The people who have heard to all the presentations in this seminar have observed the information in each one of the programs. I dealt with the labor programs, and now I will present you something about the condition cash transfers so that you can see what is the kind of information it contains. Where does this information come from? From the official sources, the registries, and shows a evaluation of these non-contributing social protection programs in the region. So the information in these databases is qualitative and quantitative in nature. First of all, we have the information with general characteristics, including the period of time, the web address, the registry of target population it uses, the criteria for admission and discharge, the responsible organization, the sources of financing, and some components for each one of the programs in terms of the nature of the transfer and the monetary benefits.
De estos programas, el gasto, la cobertura, los montos.
This has to do with the spending, the amounts, as well as the coverage of the persons. This is scheduled if there is information from the institution. This is well spread in 23. We heard that from March 277,000 hits were made. If you're looking for a program, the first results will come from the database because citizens use this as source of information on what the governments are doing. In the academia, the available information has permitted more than 250 publication until 23. That is, with the spending, the coverage from database. I here show you the website, and there's a QR for more information. A main screen shows the database is available. There is a listing of programs with all of the programs from all countries, and if you click in these programs, there is information that had been submitted before. You can also download this through Excel. You can go through this and scan it. Now, where does this information come from? This comes from official sources, from the appropriate websites and official documents. Institutional memory, status, impact assessment, information on the budget comes from budget law or budget execution. Some countries do have platforms that make our job easier. Here in Chile, for example, there is a social and non-social program where we can find the coverage and spend information on site. And we also have Coneval from Mexico that has assessment reports with detailed information. often with programs, we just don't find information. So then we request information or we use the focal points to request information. Since this is currently happening, often we have annual information, but we also have difficulties that I will name presently. So, what are the difficulties in availability of information coming from administrative records? Most countries do have a great amount of information available, but in 1212, much information was hard to get, but right now it's available. Although we do find issues such as the updating is not highly scheduled, they are late, or they are not available. Now, there are changes in the websites because of regulatory changes. There are changes in the digital platforms. Sometimes we know how to ask, but the program has changed names. There are changes in the agency in charge of the programs. There are partial data available in the reports, and there are changes in the series of coverage. Let me now tell you about the methodology to estimate spending and coverage. We have two series, one that is the coverage, another spending. Here we have the details for the condition transfer programs. We have the evolution based on total population, poor, poverty, and extreme poverty. And here in the non-contributory pensions, we have GDP, social public spending, and social protection spending. Alberto showed yesterday the evolution of these systems for people older than 65. I will bring you some of the information we have. On the left side, we have condition transfers in 21, for example. It reached 0.6 of GDP, covering 25.9% of the population. On the right-hand side, 0.42% that are non-contributory and reaching 27% of the population. As to labor inclusion, we don't have coverage and spending because of lack of information. So we look at the labor inclusion programs according to evolution or according to what has been accomplished. In some governments, the academia was not able to have access to this information. During the pandemic, for example, though, we were able to quickly react and the information was systematized in terms of the emergency action adopted and made available to the population. One example is the social development and COVID-19 database with 570 measures adopted by the countries. And this is done by country, by type of program, and it is available online. So we have accrued knowledge in non-contributory programs as well as emergency action because of the pandemic. Lessons learned, especially with we've learned in managing and consolidating information systems for the designing, monitoring, and assessment of non-contributory social protection. It's very important to supplement the information between administrative records and household surveys. We can then overcome the limitations in data. And here we can optimize the allocation of social benefits. We can also face the challenges of the statistical data that are just invisible. Administrative records are more reliable, more precise, but we also have challenges in the disaggregation of data. We as organizations that support countries have to think about the challenges in systematizing the information, looking at what the countries do, and also taking a look at the accrued information and the analysis of administrative records. Thank you. Thank you, Nisi, for this very interesting presentation. I now give the floor to the discussants. First of all, Ms. Francisca Gallegos, Undersecretary of Social Services from the Family and Social Development Ministry, Chile. You have the floor, Francisca. Thank you very much for allowing me to comment on this. We have so many challenges in our countries on how to um, make available administrative data and also looking at the wealth of this data. And this in turn is positive for public policy making. Colleagues always wonder how to obtain more results, how to become more efficient in social policy, especially in non-contributory social protection. We are successful when we find timely, reliable information that in turn can change the orientation of public policy. Let me here continue with what's been said here by Ms. Poblete, and this has to do with administrative data, but looking at the implementation of social programs. I have colleagues here, I see colleagues here from the World Bank who are going forward in the interoperability of uh, primary health and social services in Chile. Primary health is very important. This is a benchmark where the population feels it's well attended. Health issues have a social aspect, not just having to do with health, but we can wonder how health data and other kind of data can be very useful. Last year, we started working together with the health department in order to relate social assistance and primary health services in communities. A family may go to a health center, and there, if they find that the benefits are not received, then this person is immediately sent to the agency where that benefit can be reached. Perhaps if vaccination isn't available, then this person can have access elsewhere. And this is time saving, the service is of better quality, and in turn, we are able to add this information to administrative data. We've always said that we must be comprehensive. We must respond with facts. Two other examples in the use of administrative data, and that has to do with attention during emergency. Here in Chile, we've had to rebuild the communities, and we've had to assist people in Valparaiso who lost everything. We're talking about 21,000 persons and more than 8,000 homes that were destroyed. I've been working with housing and urbanism, and we have deployed social assistance modules to take a look at the housing deficits, looking at what are the alternatives of reconstruction as well. So we're talking about two big institutions such as health and housing ministries together with social development and becoming, shall we say, the bond between these institutions. And here we look at a virtuous circle, always having people at the center. We've also worked with care systems as of administrative data, having a manual of more than 50 programs and 15 public institutions in order to make up a set of information on care. This has been made possible because of our commitment in interoperability, talking with administrative data. One of the most important things that we must bear in mind is related to IT, availability of data, software, political will. But I'd like to insist on the public institutions and the urgencies involved. We may have a culture whereby we wish to respond correctly, but we must also have to remember about the role of that institution in trying to solve a social issue. When we want to change this culture together with that goal, then it could be that the interoperability and the use of administrative data may uh, be more virtuous. We have often, for example, tried to talk about the protection of the protection of personal data between different departments. But we can also find bridges in order to thus make better decisions. I would also like to talk about the standards in what is demanded and what happens in decision making. Last year in Chile, we automated the single family subsidies. We realized that there were many children who could have received these subsidies, but they did not receive that probably because they didn't know about it. Their parents didn't know about it because they didn't have access to these benefits. We've now implemented a new system, and we have found that we must ensure that in this process, citizens may also make decisions on their own data and whether they want to receive that subsidy or not, because sometimes things happen and we must recognize this when we wish to see what subsidies can be truly reach target.
Standards and ensuring communication channels with people, and that the automation does have a participatory component so that families access or reject it. And often this is forgotten because it is thought that the purpose of the benefit is in itself good. But if you do not consider the citizen viewpoint, we are affecting their view of the benefit. And then a broader view as to, especially in the light of what I said earlier, I think that moving ahead in placing at the center the administrative data for design and monitoring and assessment of social policies is essential. And I'm saying this is essential to make decisions, change directions, optimize processes, and make decisions, because Latin America, and particularly Chile, today faces major challenges regarding non-contributory social assistance. This was shown clearly in the pandemic and other occasions. We have spoken of how social protection programs, non-contributory, must be reviewed in the light of the current state of the poverty in terms of the income, but also regarding the levels of requirement that we would like to impose as a country regarding universality of social protection. So administrative data must serve to make decisions and changing the direction. When we have monitoring and assessment, surely the monitoring data will allow us to say, okay, it seems the decision made last year to this year is no longer any good. And sometimes when we have only monitoring, but do not change the direction, the information that is sometimes not evident to say what we are doing is not working well, if we're not able to change the direction and course, it may be we will not be able to have an impact as expected. And learning have to do with the pandemic, also the emergency, systematic crisis that convene us to react to the data that we get through monitoring. Third, We have experience that has been virtuous regarding how we are able to reduce the amount of red tape and time invested by people and how to have far more robust and speedy processes in terms of providing benefits and social aid. And I think that the monitoring and evaluation data there are substantive to provide results in terms of opportunity. The pandemic told us a lot. If we don't arrive on time, we do so late, and the impact is very significant. And finally, we believe that the use of administrative information and being able to move ahead should allow us to avoid duplicities in what we do when we are able to identify efforts. Integral efforts in terms of social, non-contributory social protection, and that sometimes this is done supplementary in different sectors or portfolios. We see that sometimes we have the same purpose where we are applying efforts, and when we do so integrally, we see that it is possible to avoid the duplicating efforts. And to close, once again, I would like to thank that you've allowed us to be part of this. We are attentive and hope to continue contributing to all the information that is required. Indeed, we have very interesting challenges in terms of the administrative use, but I would like to insist above all on the relevance of managing change and the investments that we need to make so that people are able to move ahead, ensuring that our technological tools may also be used for institutional transformation, placing at the heart and resolving the needs of people and not just echoing the functions that as a rule traditionally we've had at these institutions. Thank you.
Muchas gracias, subsecretaria.
Thank you very much for this, Undersecretary, for this very interesting presentation. I would like to, since I have the microphone, say that I would say it how important it is having this information so as not to duplicate efforts. We as international agencies, we do studies and analysis. We see that this is the case because often we work with ministries and we see this need for further communication. And the last thing that we also touched in the previous session, that is the data or the relevance of working based on promoting the rights of people. And that information is not important in itself, but rather a means in order to support the population and in particular those people who are more vulnerable. And now I would like to hand over to our second discussant, Maria Esther Jimenez, who is Vice Minister of Social and Economic Protection and Promotion, Ministry of Social Development of Paraguay. Vice Minister, the floor is yours. Good afternoon. It is difficult at this time after lunch to pay attention, but I would like to say that I don't know if the right word is overwhelmed, but above all, it is a challenge that we face as a country. And I would like to say that about 3 months ago, the entire non contributory pension system moved to another institution, and we are now beginning to migrate the system. But there is information because it used to be in finance, and so much so that now ECLAC people have access to data and have in that big database issues related to non-contributory pensions. Nevertheless, what I would like is, since I'm told to comment here on what Vincent said, and also our colleague from Chile, it is very relevant to understand what has been repeated many times. What are these records for, above all? What is the relevance of these records? And I'm sure we all agree, and it's been said in different ways by all discussants and panelists, that it is very important to make decisions as an instrument to classify something, but for decision making in general within the social protection system. And I would also like to highlight the need to invest in fundamental aspects of technology for a proper use of information and the specialization of people. That is what we feel in our country. Specializing the people that are going to use the data, analyze the data, present the data, and provide an input for decision making. That is what we most feel in relation to this. I'm now making a comparison. This of associating everything regarding non-contributory pensions to contributory pensions and an ample concept of the social protection system. In our country, so far, the social protection system has been associated with social programs, providing some sort of aid to the more needy sectors of our population. It's only just now that we have a new plan for the reduction of poverty, but this needs to take root within the institutions and within all state and government institutions. There's one important matter that came up here regarding political will. We all need to work with subnational governments, in our case, municipal governments. Trust. Trust in the activity and what the information system is going to be used for with my information that is taken from me, and what is going to be done with this information in the hands of politicians. A regional governor, a governor, they're all politicians. That has to be overcome, undoubtedly, but the strategies are different because also that sort of institution or makeup are variables in each country. And a colleague from Brazil said 5,500 municipalities, and I say we have 256 in my country, and we are swamped. So I would also say that it is important to systematize having data that are traceable and comparable, because otherwise we don't want to give out information regionally. And this is what ECLAC does. They make that possible so that we can learn from comparisons. I would also like to highlight the interaction with the community. As a rule, we try to locate them and provide for them, but not provide an opportunity for them to be part of the provision. In my country, regarding non-contributory pensions, tomorrow I will speak more of the transfers to vulnerable sectors because we already have a tradition that goes back several years. But in the non-contributory pensions, and we're thinking of the elderly here, this is a selection based on a budget, based on certain criteria, and a payment through the Ministry of Finance. The system, of course, allows the selection to be done with an algorithm, but also a selection based on the existing budget. We have broad coverage, yes, almost 60% coverage, and we have moved ahead quite a lot. And I often ask, well, why don't we move ahead like that in the Ministry of Development? Well, because it's in the hands of the Ministry of Finance, so they themselves were able to strengthen and assign a budget because our fight with the budget is essential. And also, as the Minister of Costa Rica said, and I think that this is worth paying attention to, Because systems such as ours, where we are more parliamentary than presidential, our budget is given to us or passed by parliament. So having data, records, statistics, verifications, what is done with the data, how many people actually are benefited by this, and in my view, that transparency allows convincing those people who are in parliament to approve the budgets for that. And then also the interoperability. We need to talk among different systems. In my country, the systems don't talk among each other. We're making headway, but we have a lot of way to go. We have studies, especially ECLAC has contributed greatly to what was done in Paraguay. And so, but we're on that path. We need to understand conceptually what a social record is. It is an administrative record because there too, there an issue with understanding. Because if people who are making the decisions don't understand, they're not going to give it any importance, and that won't continue to develop. So I leave it at that. Thank you very much, and excellent work once again. Good afternoon.
Muchas gracias.
Thank you very much, Vice Minister, for your comments, and also because the points that you've put up for discussion and that we mentioned in the previous panel, political will and trust. This morning, while we were talking, I recall that we all have a mobile phone, but as a rule, but in the private sector, we accept the conditions. But when we're in the public sector, we all the more must inform what we're doing with information, what use is being given, and so on. There's an issue of fear among people of providing full information. And this, of course, has been validated by different situations. But it is interesting, this point of the political will and the validation of the trust. And so now I would like to hand over to our third panelist in this session, Camila Arza, who is a senior researcher at the Interdisciplinary Center for the Study of Public Policy, Argentina. Camila, please.
Muchísimas.
Thank you very much. I would like to thank Claudia Robles and all the direction of social development of ICLA to invite me to participate in this seminar we had already to enriching working sessions. I would like to comment from the perspective of the social research. The presentation by Ninsen. And I would like to highlight the significance of these sets of indicators for social protection as the databases for the non-contributed social protection that ECLAC has built recently. I would like to provide a perspective of the importance of information in the analysis and ensuring the assessment of the social policies more broadly, not only the policies or programs or non-contributed systems. As researchers are obsessive about searching the variables, factors, and quantifying things, I will present in these slides and the next ones the dimensions of analysis upon which I think we should develop further indicators. And I think that we have already developed many of them. We have made progress, but we still have some challenges to face. In terms of the indicators within the system of social protection, we can distinguish two of them, the indicator for design and the indicators for results. In this, we are referring to the risks covered by a system, and particularly the architecture of the social protection system. In terms of results, we speak of the effects, what is produced by the policies on a set of variables or dimension of interest. During the last 2 decades, we have made important progress in the creation of indicators that is comparable among countries and inside each one of the countries for these two dimensions. Which are the sources? Vincent already showed the potentiality of these indicators for the indicators in the long term that can be used for the evaluation and the monitoring, as well as other sources that can be used jointly. As a matter of fact, we do that in the research as with the surveys, and also it's also for legislation. That is another important source to think of the design of a program, how it is organized, and obviously also including the budgeting and other sources that can be built. Well, see, first of all, the design indicators. Till not so long ago, in Latin America, we didn't have the design indicators that can be comparable as those that we have today, thanks to the databases that Vincent was commenting and that was built by ECLAC. In general terms, we didn't have information or databases that allowed showing for all the countries how the fundamental conditions for the design of the architecture of the social protection system has evolved. And here I'm presenting four elements of the architecture, and this is inspired by Degas and Sancochet, and how to classify the different elements for the architecture of such program. Uh, what do we speak about when we speak about architecture? It involves a different aspect determining the functioning of the program. This is in the legislation. And that's why I say that the legislation is a very important source of information to see the target group, the benefits, how much is offered as a benefit in terms of monetary benefits and social services, the financing, how much is invested, how it is funded, the origin of the resources, and also the institutional framework, who is regulating, who is providing, who is overseeing the role by the federal government, the local governments, super regional governments. And an important topic that was raised in many of the presentations is how the COVID pandemic let us develop most of this information for a particular point in time. And it is phenomenal to see how many institutions, including ECLAC and many other international organizations during this period of time, built the databases for the registry and the design of the policies that were put in place. We knew at that time what each one of the countries was doing, what kind of policies were developed, and in the case of the UN women, they had the gender break down, and the generation of the different policies developed by the country. As Nielsen showed, many measures were classified by ECLAC, and other organizations did the same globally. Then we were able to conduct quantitative studies of the policy responses to the pandemic that beforehand were not possible because we didn't have a record of these policies that were implemented those times of crisis. So it's very important to see how this generated information can be helpful to understand, to compare a historical process that was so peculiar as the pandemic was. Now we'll go to the result indicators. Obviously, here we are highly interested in trying to understand what happens with a policy, the result of it. I'm not only speaking of evaluation or impacts from the technical point of view, but what is granting and what is assigning in practical terms in legislation. We're going to have the eligibility of the population, but we know that this is for the formal coverage, and the effective coverages can vary in our countries where there is a high level of informality and not everything that is put forward in the legislation is implemented later on. So we need to know the result. When we speak of results in terms of coverage, we should know the number of benefits offered by a program and to which degree this is covering the target population. The ICLAC also deployed an important effort trying to define the reference population. And this is another challenge for the use of um, administrative records. And we have 1 million benefits. We have to decide where we'll use it. We use normally the population over 65 years of age, but in some countries over 70, or in other countries over 60 years of age. So there are some challenges for comparability. An important aspect or an advantage in a certain way of these administrative records compared to the household surveys that were used normally for analysis. And in terms of the coverages where we have made more headway in the last 15 or 20 years, we know much more today about coverage today. In the administrative records allow to know how many benefits are provided by each one of the programs, and this is not the case for the household surveys because they measure in general terms and they do not distinguish a benefit from the other. Sometimes the benefits are evolving and the temporality is not the same. One, there are some benefits that are long term and other ones for just one single year. So this allows to know the distribution of the coverage among the programs. It gives more visibility. And the challenge now, as I was commenting beforehand about the reference population and the overlapping of benefits, that can be a person who receives two benefits, for example, a pension and a survival pension or allowance. So we have to decide if we are going to consider this as one single case or two cases for coverage. Now, the two other dimensions that are relevant for the analysis are the sufficiency and quality. The dimension of equity in terms of sufficiency and quality, the challenges are larger as compared to analysis of the coverage. They are larger in the social analysis and the transfers, the sufficiency measuring is easier because we have major progresses. The non-contributive social protection programs shows us some amounts beforehand. We had to see these country by country to see the benefit and the amount of each one of the benefits, and this entailed a lot of work and the restriction to do comparisons amongst countries. And this is very important with the generation of comparative indicators, but we do not have this information for all the cases. For the contributive pensions or programs, we don't have the same information. We don't know how much they will encash for the maternity benefits and so on. And sometimes in the contributive cases, we don't have a comparable basis with the non-contributive symptoms. Other components now, other components in other areas, including the healthcare services, the care system services, is more difficult, and measuring the quality is also more difficult. As Ramirez said before, in Mexico, the number of relevant indicators we have, and that we should examine and they have to examine in order to evaluate and analyze the healthcare system in Mexico. And this happens everywhere. We need to have all this information from a comparable perspective so that we can have a source of information that is more comprehensive and complete to measure the quality and efficiency in healthcare system. Finally, quality is also very important, equality. And I'm not only speaking of the equality, distributive equality, to see if the rich or the poor people receive a benefit, because this is a very important dimension and normally is assessed through household surveys and not from the administrative records. If we think of the potential of these administrative records, we have to consider the fragmentation and segmentation of the programs. This is a centerpiece in the system of social protection today in Latin America and the Caribbean. And we need to have this information and to know who receives what kind of social benefits, not the number only of people who are receiving the benefits. That we should know the social sector, if they are women, males, or if they have more schooling or less schooling level. And we need to think of the interaction of the social records and the information collected with the uh, social registries as a source of information for analysis, for research, as well as for follow up and comparison of such programs. Finally, what are the challenges I see in terms of the construction of indicators for social protection? There is no doubt that from the perspective of social research, there have been major breakthroughs. Today we have an enormous number of data available compared to the situation years ago, and it allows to conduct better analysis and to contribute to the design of public policies and to interact with the policymakers to do recommendations in this connection. There are many other dimensions that are still missing, and I think that there is a lot of information that is out there, but we need to systematize this information, organize it, and to make it available for the analysis, the monitoring, and the research. We know if the programs are targeted or universal, but we do not have a systematic record to know about the targeting system or the degree of targeting. We know it for some of the countries, but not on databases. The indexation is also very important to determine the sufficiency of the programs. We know the amounts, but what is the criterion and the mechanisms of indexation, the countries that have a high inflation rate and so on, and many others variables that could be mentioned.
And in closing, and not to take up more of your time, let me say that this progress and potential involved, aside from new information that could come about, we still have to reinforce and deepen exchange, collaboration, and create more synergy between researchers, as well as international organizations and naturally governments, institutions that are in charge of social programs. We need to exchange more information and to jointly identify the variables, using them to improve the results of social policies. Thank you.
Muchas gracias, Camila, por esta.
Thank you, Camila, for this very interesting presentation. You did talk about all of the challenges in the region and equality and administrative data. It's very important to show up all sorts of information and how to make more visible a population that has been hidden for quite some time. I immediately give the floor to the last discussant, Sandra Wenchuan. She is an officer from ECLAC, Social Development Department, Mexico. Thank you for the invitation and the chance to be here with you, with all of you. I know that in coming last, as always, just about everything has been said. We've been hearing about such positive and interesting things, so much so that I would have changed my presentation had I been able to. But rather than concentrating on things that have already been said, I'd invite you all to reflect on the context behind the production of information. What do we want better administrative records? Why do we want these indicators? Not just for the sake of research or for having data in a database so that we may know how many programs are being implemented in the region. That is a stage that, yes, we should have overcome by now. There is a checklist of programs, but this is not what we read in the goal from SDG. I would say that this must be supplemented, that SDG talks about the production of a coherent and timely data. And here I'd like to talk about the timeliness of the data and its purpose. During these 2 days, we've been talking about the different risks we find in our societies. These risks have to do with disease, hunger, death, dependency, unemployment, accidents, pandemics, and disease at large. Now, social protection systems. What is their role in view of all these risks? Why? To protect individuals from these risks and protecting us because of our own vulnerabilities. What happened during the pandemic, where a person was confined at home doing e-office, that's one thing. Another thing is somebody from Mexico living in an indigenous people with 5 children without internet, where they had to go out to sell their tortillas and so on. Okay, who is behind social protection? This risk becomes a vulnerability. And as we heard from Mexico, there, aside from pensions, there are a series of social services that protect people from these vulnerabilities. Now, you may ask, what does this have to do with administrative records? Well, I do have something to say here. The purpose of the information that we will improve, that we will provide, that will be timely and coherent. Let's remember what happened during the pandemic. At the onset, we didn't really know that the elderly people, 75 or more, were going to be especially affected by the disease. But after some time, we realized that that was so. We heard from WHO and from Europe We heard about the data, but when we went out to search for this information and the data on COVID 19's impact on people in the countries, we just didn't find that information. There are very few countries that had public information on age groups and their impact because of COVID. So we had to go beyond the portals such as Peru and Colombia and Cuba offered, as well as Costa Rica. We had to go beyond looking for information that would tell us what was happening in this region. And this actually is complicated. Well, because not all human groups have the same statistical visibility. And here I refer to the older persons. One of the great deficiencies is precisely lack of information on the elderly, lack of disaggregated information. We can have data on degenerative chronic disease. This is there. The epidemiology studies are made public, but we need disaggregated data. And this is part of SDGs. One of the variables that should have been easy to set up is disaggregation during the pandemic between gender and age group. The older persons were the ones that suffered most from that disease, but that information was not available. So we have to go beyond when we think about the production of data. We have to figure out what do we want, what for. Indeed, ECLAC reacted quickly, saying these programs are there, exist, and this is what has been done in some countries. And the voluntary reports as well, but we still needed data on individuals. We only heard, well, Mexico did have age group desegregation, as well as segregation between having to do with the places where they live and also information on ethnical group. But we still needed more. We know that the older persons were more seriously affected. But as we know, groups change from country to country. Everything is different between our countries. And we also know that the more needy were more affected as well. Now let's think about what we must do. We must go forward in a new social compact. We're now discussing the summit of the future at UN. There, we also hear about the need of a multilateral compact. One of the key aspects we hear has to do with social protection. But for this protection to be timely, to truly reach the target groups, why this information is much needed. But we don't just need any kind of information. Are we going to build this from decentralized guidelines or centralized guidelines? We don't know. How are we going to go about doing this? In the region, in order to hand over a non-contributory pension, for example, we had to conduct a census of people older than 60 to see who really needed them. But then it would take 2 years or even more for that pension to be awarded. These are things that we have to fix. We also have to work at territorial levels. This is fundamental. I have another comment, and my last comment. Amalia. In this discussion having to do with universal social protection, here at ECLAC a few years ago, we heard that universal social programs, we heard that it was going to be cheaper to provide universal pensions than setting up a whole system in order to have more focalized pensions. What happened? Some countries would get indebted to target these pensions. Others took years to go about this. During those days, then we said, okay, if we're going to make this universal, we have to figure out where to invest. And now, once more, when we're talking about improving social protection, we must also have that in mind. If we think about these information systems in improving these records, then we have to figure out that they are going to be useful because we have universality in mind and not just obtaining data for the sake of it. Usually, data has a purpose. On this situation, we have the idea of reaching individuals who need so. We have to go out, and there we have these indigenous communities up in the mountains that are difficult to access. So it's very difficult to think about all of this. Not just saying we have to have a new social compact. It's not enough to say these programs have to be universal or that we have to monitor. Why do we need administrative records? We have a great mission, and that is to improve the quality of living of persons. Thank you for your attention. Thank you, Sandra, for these interesting comments and for saying that people should be at the center rather than data and the importance of having information, but also figuring out what these data are going to be useful for. And now we hand over for Q&A. We are addicted to information, yes, but we also have to figure out what that is going to be used for. I hope my colleague Mariana won't scold me, but right now we should have a quick pause. I'm afraid we don't have coffee available outside, but we will have a few moments to stretch your legs before we uh, start panel number 8. Alexandra and Juliana, go ahead.
I would like to thank the Undersecretary, yes, because she must leave. So thank you very much for being here and bringing us the Chilean experience. And we understand perfectly the situation. And in fact, I would like to take the opportunity to mention that the situation in Chile is complicated on account of the fire. So we really thank you for because there's an urgent policy matter at hand. Well, the panel had very interesting presentation. I would like to simply highlight something that Sandra said at the end that I believe is crucial, along the same lines of what I was saying yesterday regarding the use of tools at the service of social protection to focus on poverty. And so returning to what you were saying regarding the technocratic decisions that we make in the world of social protection, perhaps the technocracy clearly does have an impact. Considerations relating to human rights and policies, so much has been said here that affect social cohesion and the creation of these social compacts in favor of equality. So often when we speak of the mechanisms used in systems or mechanisms of the social protection system to be more efficient and to improve the social protection programs. In doing so, we often forget all the standards, obligations, and principles of human rights that apply. Because social protection and social security is a right, and all standards and principles contained in the universal and regional instruments of human rights also apply to those processes. And so there are so many elements that are practical. And unfortunately, very often in the design decisions regarding public policy and social protection, we forget the applicability. But this is not a matter of idealism or utopia, but they're very applicable in practice. And there are very many examples. And there too, there's this matter of speaking of information systems, systems of administration at the service of the integration and an inclusive approach to social protection and social records that are in many cases specifically used to focus on poverty. So with that, I'm getting at a topic, and I think Sandra mentioned it, but this has to do with the administrative cost of creating a system that focuses on poverty and of maintaining a system for it to meet the aim for which it was created. That is, to create adequate information updated. Because if we need to update it every 5 years, those of us who work at this know that the vulnerability and poverty changes almost on a daily basis. So the picture that you have today is different tomorrow. So that is something that I also wanted to highlight. And I also found it very interesting, Camilla, the indicators that you were presenting. And I thought of the possibility of considering an indicator that comes from the world of social, economic, and cultural and environmental rights and has to do with process indicators. Because maybe one of the most important things that I see, the most important gaps that I see in terms of the right to social protection and the practice of this has to do with processes. How do you implement that process? And the Vice Minister of Paraguay, as well as also Costa Rica and Chile, all spoke of processes that had to be taken in for the perception of the beneficiaries and so on and so on. So the process implemented for a record or any process to record a payment or whatever also has to do with how those processes are. The dignity of the beneficiary, autonomy, but so many aspects that have to do with how this is implemented, and it has to do with the street level bureaucrats and how the implementation is experienced by citizens. I'd leave it at that. Thank you. Well, thank you very much. So many interesting things invites us to continue reflecting on these. How do information systems reflect the multi-crisis society that we're living in and will continue to do so? In December 2019, I don't know, COVID was already a problem in China, and we saw it as something that was so far away. But by March, people who were very stable in December had lost their income, and it was necessary to create things that had been said. So what should these information systems be so that the vulnerability thresholds should not take us by surprise, and that we may have to once again run out to create information systems to keep up pace with the demand. And so, well, and this fire in Valparaiso affected people that were already vulnerable, but it could, as in California, affect middle to high income families and people who never thought that vulnerability was part of their life. And so within that framework, how should we go creating information systems, mediating highly heterogeneous context, scale issues? Brazil is not the same as Costa Rica or Uruguay. And so then, yes, entire population is covered, and you need to just bracket out those that do not need A, B, or C, and be able to make quick decisions based on the social risks that really we cannot conceive clearly right now, especially those linked to climate change, but neither can we discard others linked to other episodes. And this brings us, as Alexandra was saying just now, how the information systems better reflect the social contract, because the social contract, and Mark also mentioned this yesterday, this is not just a concept, but rather it is a public management tool. And the section of the population that most has and least contributes, even tax evasion, and we will all have an interest in knowing, in Costa Rica, we're fighting with these sectors so that the Ministry of Finance may be able to go to find out something which is of full public interest, but not to be published simply for the fiscal collection. So inequality with which we people are being apprehended in the information systems reflects the historical inequality structure in Latin America that we still cannot break down. And so that we, at the same time, we should try to break down those gaps, or fill in those gaps rather than widening them. Because if the population were in the information system and we had equity indicators, well, we cannot measure equity. We don't have the full gender inside. Otherwise, we're measuring the same people as always, and the people about whom we have a panoramic view regarding their full activity. But the rest of society, those that are better off, are left totally outside. Thank you. Well, thank you very much, Alexandra and Juliana, for your comments. And I think that this is very supplementary to what we've been talking about here. And with Alexandra, we were talking about all these challenges in terms of rights imposed and, well, that we must discuss in the information systems. It is necessary to move ahead in this discussion in Latin America regarding the use of this information, the data privacy, and how certain rights are being breached in this process. Well, and now I would like to hand over, or no, assign some time rather for people to stand up before moving on to the next session. So if you'd like a minute to stand up, I don't know, maybe go to the restroom, but 1 to 2 minutes, no more. And then we will be back with the next and last session. There is coffee, but at the closure. So please keep your energy until coffee break time later on.
A nivel alto. Buenas tardes. ¿Me escuchan? ¿Se escucha? Buenas tardes.
Sorry to scare you, but we are going to start now. The eighth and last panel of discussions.
No, creo que Alberto se va a pasar.
Los invito a volver a sentarse.
Please be seated. I invite you to start this panel.
Ya, ahora sí, vengan a sentarse.
So please be seated so we can start this eighth and last panel. In this panel, we're going to visit the challenges for the financial sustainability for the social protection schemes. First of all, the director of the unit, Alberto Arenas Meses, will make a 15-minute presentation entitled Financial Sustainability to Move Forward Towards an Inclusive Social Development. Later, we will continue with a round of comments. First, Mr. Jose Carlos Cartona will start the ministry from the Secretary of Social Development in Honduras, then Recipal from the Economic Development Division at ICLAC, and Noelia Bernal from the University of El Pacifico in Peru and consultant for ICLAC. So with no further ado, I will give you the floor, Alberto. You have 15 minutes for your presentation. Very well, fantastic. As we say in Chile, in the last panel, nobody can be upset. So, when Claudia asked me to speak about the financial sustainability for social protection, I said that this takes more than 15 minutes because social protection is like a universe, and I was already pointing out a series of issues connected to social protection. That is a whole universe. But it's always important within this universe, and in 14 and a half minutes that I have left, I will highlight the financial sustainability to move towards this inclusive social development. The main message is conveyed the region is facing a social and economic situation that is complex. And we are saying that effectively the region is facing a region with three components: low growth, high inequality, and important institutional deficits. And in this context, the evolution of the social expense or expenditure has challenges for sustainability. As a matter of fact, to move forward in the eradication of poverty and reduce the inequality, and in this context, the reinforce the social framework is important. And once that we have those resources, it is important to meet the objectives. And from this point of view, the challenges for the social protection are multiple. Today, we will try to point out a few ones, but basically, we are convinced, not because it is a SDG of the 2030 agenda, but we're convinced that there are some strategies within the social protection schemes to tear down poverty, and this proposal can be prioritized. But this is a goal that will require financial sustainability as well as many other things in order to get there. And in this context, we move ahead in the social pact and together with the fiscal agreements wouldn't to guarantee the financial sustainability. As Claudia said the first day, the world is changing with demographic transformation, environmental transformation, economic and social changes, labor related changes where we need to accommodate. And this will bring along also a demand of increased resources. First, we have the challenge of the um, social protection. The, is the ability that the system of social protection have in order to honor their commitments in a series of time. That is to say, to honor the commitments vis-a-vis the present generation and the next coming generation, so that this is sound in economic terms, and to have a coverage that is suitable, that is accommodating to the new sensitivities and the economic sustainability. And here we have a set of elements that are balanced, and this includes sustainability. But is in this sustainability is depicted here very clear, but it has a condition that none of these dimensions, none of them should jeopardize the rest. That is to say, if the financial restriction is going to jeopardize it. However, this will not be sustainable, or if your benefits are very low, the system of pensions, as in the case of Chile, is sustainable from the financial point of view, but it has an inefficiency for coverage. The sustainability then has different dimensions. First, there is the financial dimension that we'll discuss here now. I first said that we have this conditioning, and there are three dimensions. As you see, the region is going through a low growth rate. And ICLAC called this the lost generation. But You can see the first circle. In average, there was 1%. And in the last 10 years, the region is growing now at 0.8%. From ICLA, we say that we're facing a crisis of development that includes three dimensions. So first, a low growth rate, and this jeopardizes the financial and fiscal sustainability. And on the other hand, we have a very high inequality. This is the second dimension mentioned at ICLEC. There is a high inequality. It's not the same to face the low growth rate vis-a-vis demand. And there is a third point that is related to the region. The region has some deficits in the social institutionality that also condition the social protection because it's not enough to have the resources and the good design, but we need to have the willingness to implement all of this, and this is in connection with the institutional framework. We have a position document in our regional conference of social development that is presided by Chile today. That the Minister of Costa Rica is the Vice President of the committee, the Minister of Honduras and Panama, who is not here, but we worked on this issue of social institutionality as key points to move ahead and to put in practice all the policies that have been debated in the last 2 days regarding social protection. But there are some deficits at different dimensions, and in this trap of growth, there is also a trap of institutionality. It's not only a macro issue, but there is an issue related to um, do this at the regional level. And now we should see the investments in social protection within the region. As you see in this graph, there is this um, leap ahead. And before and after the pandemic, and in general terms, increasing 2.5 points of the GDP. Those that are 2.5 points additional to the GDP. And what happened in our social um, or outlook? We show that this is so. And this is not only the result of the pandemic, and we could understand that there were some topics that were transitory, but also, some other structural problems were present before the pandemic, and in a long-term crisis continue to be with us. And it went from 11.2 to 13.7 points of GDP, and these are 17 countries of Latin America that we have in databases that we have worked on. Went down to 2.7 and 11.5 in 2022, and now we cross our fingers that the data for 2023 will not be lower than 11.2 because we were at that time in a crisis, but the resources are showing that we will continue to have the same number of resources. And the question we would pose if we will continue to have the same problems of the pandemic is rendering this more acute some problems, including education, healthcare, and so on. There is a topic because the sustainability from the financial point includes funding. And here, and this is part of what I would like to share with you, how we achieve so that the social protection and we can convince those who are not in the room. And the role it plays for fostering the strategies for inclusive development.
Bueno, es
This can be seen by subregions. Here we are looking at different subregions. But let me say that it's 11.5, but there's a tremendous diversity. Some countries come to 14, others less than 10. So there are different averages. Our moderator He's in charge of telling me when to stop, please. But this document has to do with sustainable, financial sustainability and education in the region. We um, had a ministerial meeting with UNESCO, UNICEF, ECLAC, and 28 of 33 countries were here present. And the resolutions had to do with the challenge of financial sustainability in education in the region. I, on that occasion, did bring in this document, but there's one detail that I wanted to bring to you. The region invests in education, but it's not enough, much less than OECD. Sure, OECD has more per capita income, but what I have said here is what is spent per person, per student in the region, comparing to what a developed country spends is 5 times less. Now, in talking about narrowing the gaps, narrowing inequality, etc., right, financial sustainability is indeed an element to consider. Yes, I am an economist. I'm very interested in this, but it's not the only topic. But the social protection should have financial sustainability at the core. What else did we do? We looked at the financial sustainability of pension systems in 8 countries in the region. We made the documents and when we published it. What were the important topics here? Financial sustainability. So we saw that there's growing demand for pension systems, and this we know involves much investment from the treasury. But we're talking about public finances. When we want to reform a pension system, it takes more than 1 point of GDP. 2.5, for example, can be needed. So we're talking, yes, about financial sustainability, but the greater discussion has to do naturally about the fact that the public basket has to change. Naturally, we spend 4.5 points of GDP, and then we go to 5. And the World Bank is saying that this is going to come to 6 or 7 points of GDP without leaving our offices. That is, aging means that people who will demand, older people will demand more and more pensions. This number is growing on the rise. So financial stability here is very important. Mariana, how long do I still have? Well, I am director and she works for me. So I guess I can go on, he says. No, no, please stop me when the time comes. Well, here we have the standard of spending. There was a time when we said health, and the ministers of the region said we have to spend 6 points of GDP in health. This is macroeconomy, and that's macro. And this has helped many countries to have a kind of framework. They're either high or low according to that pattern, but 30% of this goes to primary health care. These are standards that were placed by health authorities. And UNESCO in education did the same. They said between 4 and 6% of GDP, and between 10 and 50% of the nation's budget. This is the standard. Culture did the same thing. We said we won't ask more, just 1% of GDP. The investment for disabilities. In the regional conference, we will continue working with the presiding officers on social development, and this meeting will be held in Barbados in the second semester. We want to make forward in public spending and non-contributory pension, social protection, non-contributory social protection. Here we have a document, and here we studied because we made a calculation. We asked what is per capita GDP, what is the spending in the countries where we do have information. There are 14 countries, and we divided them into three. What is the gap, we wondered, that exists so that the families in poverty or in extreme poverty, from a mathematics standpoint, may come to the line? What are we talking about? How much? We all know that poverty cannot be solved by math. It requires comprehensive policies, but still, we wondered, what are we talking about? If SDG 1 says this, we have to go forward, but how much does this cost? So we made the following calculation. In some countries with 2 years spending 1 point of GDP would be able to do so. Others would take 3 or 8. Of these 14 countries, if in 10 years they have a fiscal effort deployed so as to reach the target population, indeed they could create income among the population that would be similar to what is desired. Okay, final reflections. Most of this has already been said. The expansion of coverage in social protection has been quite efficient, we believe, when we analyze the case studies. Not only because of the levels, but because what has been accomplished in the last 20 years in the region. Social protection came about by UN in 95, I think. But I'd say that a lot of progress has been achieved. And SPNCs are an example on how we can reduce poverty and inequality in old age as well. Now, defining a standard for public spending in non-contributory social protection is very important. We could even make a survey here. Promoting social protection, is it going to reduce poverty? Does it attack extreme poverty? Is it necessary? Well, why don't we have a standard? So we find that health is very important. But nobody says, no, there can't be a spending standard. But why here? That has been designed for SDG 1 at UN, that is facing poverty and inequality. There is no spending standard. I believe that the answer to this question or this fact is that the social agreements in our region have not related this with fiscal agreements. And accomplishing this is a task that has to be done in the world of finances and also social protection. As a matter of fact, it should be a priority. I believe that if we were to relate social protection to development strategies, with inclusive social development strategies in a language that would go beyond social protection, that would indeed help make headway in a world that makes decisions, that has social protection, but that doesn't manage it well. This is what we talk about fiscal social compacts. And here, there's a way towards the World Summit for Social Development. In February, UN approved a mandate for the second World Summit for Social Development. And the title is quite important. We believe that here is we find a historic opportunity, and we act like we'll be working on the regional conference on social development. We invite all countries in the region to participate. Remember, this is going to be a world summit that are responsible for 8.4%. Belgium and Norway are going to be, be there, and there we will hear about the topics that are at the center of our region. And we do believe in financial sustainability. A World Summit for Social Development. There, the financial dimension is sure to be present. Thank you.
Muchas gracias, Alberto.
Thank you, Alberto. What you said about the standard in spending is very interesting. In education, for example, having this spending standard allows us to monitor the efforts that are conducted in different countries, comparing to other kinds of policies. So what doesn't we can't measure doesn't exist, right? So having this goal is indeed, or the standard is a very good idea. I also would like to emphasize the importance of joining social and fiscal compacts and emphasizing the importance of investing in social protection. Investing on people is really the best way towards development. I now hand over to Jose Carlos Cardona. You have the floor.
Thank you, and thank you for the invitation to make on this presentation by Alberto. Today we were talking about the challenge of financing social protection. Well, the truth in Honduras is complex, very different to the scenarios being put forward here. Our director at Cedisol said that this is not a country where social protection is a matter of political discussion. And it is at an embryonic stage in many senses. We are one of the countries that in the list of nations does not have a non-contributory pension regime. And we have made efforts during this government, especially after the pandemic, to reconstruct the disaster that we've had. Imagine the country with 12,000 schools in ruins and 9,000 don't even have drinking water. No country where 500 health centers were closed in 12 years after the coup in 2009. Imagine a country where 50,000 people entered the poverty threshold per month over 12 years. 6 million people are poor and extremely poor in Honduras, with a percentage of poverty that right now is close to 62%, and extreme poverty at 51, 53%. So extreme poverty. So social protection for us, we've had to build it based on other logic. But to talk about low growth and the high debt, which is one of the things that it is important to mention, that in some countries, such as ours, for example, where we are in the debt trap and growth has been never above 3.5%, it is not easy to finance social protection programs because, as a rule, the funds don't add up. And so we need to resort to debt, and this is one of the things that happens and why we are constantly living in debt in order to finance these things. We're in debt in order to repair schools, were in debt to even work on the purchasing uh, medications. So it is difficult to understand which of all this becomes to expenditure or investment. And this is an ongoing discussion, a debate as the country. And I'm sure that you have it in the post-COVID scenario where the international banks that finance many of these programs have sat down with countries to see if they can reprofile the debt. The other thing is in relation to the flexibility of the sort of provisions. We found very positive this issue, and it has had a great impact. Subsidies on fuel and electricity, which is not considered as a direct social protection, but it is in a way. In Honduras, are 900,000 families that are not paying for energy right now, and this has become a challenge, a non-economic challenge. And it's important to mention it for them. This is not a monetary transfer, but a direct subsidy to consumption. And for every gallon of fuel consumed in Honduras, people do not pay 50 US cents per gallon. And so this is a subsidy which is quite significant and has come to translate into a way of alleviating the burden of the basic basket. I think that of the experiences I've heard here and what Alberto has said regarding waging in favor of a non-contributory pension system should mean an effort at redirecting these funds that are normally used for subsidies and having a direct impact on people's life, either paying or reducing the poverty of these elderly people with these pension systems, which is the major wager that to which and where we're going to direct our efforts through a bill, which is a key factor for this, and we will try to discuss this and socialize it with the country in coming months. The other thing is the investment in social protection, adaptive. Many of our countries have serious problems on account of climate change. We have, so to speak, the issue of the drought right now, and it's not because we're going through an El Nino period, but because this increases over years. Every year that goes by, our social structure and our quality of life is affected by climate change. Each time more weather conditions are stronger, and this implies an economic loss. And we countries do not have the capacity to substitute or reinvest in these destroyed infrastructure. There are studies for Central America that say that the percentage of spending necessary to uh, to offset the disasters caused by natural disasters is exceed our GDP, and it's not easy for a country to be every year investing in this when every year a new bridge is destroyed or an entire valley is flooded. And so this obliges us to consider these problems in Central America. So the issue of adaptive social protection, financing of migration and transit, which is another debate that we have in Central America. It's very much involved, whereas there are some countries that are trying to preventively help the migrants to go through their country quickly and move on to the next. There are others who decided to close their borders and be more aggressive because they think it is an expense that they are not prepared or not able to pay for. And so it is a social problem. It is a social vulnerability that one way or another also affects countries. And so this issue of whether new taxes should be created for social protection or not, you mentioned that in your intervention, but I think that this is an ongoing debate among progressive governments, and we are having these discussions right now. For us already, there were already taxes created specifically to finance social protection, but it was a sovereign decision of the government to use this as a single cash fund to deal with other issues. And so social protection, well, providing our services and deliverables for communities that are more affected or vulnerable with national funds or balancing or using our external funds, debt that is. And so, regarding social expenditure as such, there are some countries we are in constant negotiation with the financing agencies. We have 23.82% for 2022 in the GDP in social expenditure, but we have discovered that a lot of these agencies do not see this as an investment and they classify it as an expenditure, things that are really social investment. And it's just a way of labeling it, if you like, but it does have a direct impact because, for example, this is a very specific example, we have right now a discussion on the family health services for primary health care. And the IMF says that that is a social expenditure and that a community health expenditure is a community expense and not ours. And at the end of the day, one thing is that they should lend to you for expenditure, another thing is that they invest or lend you for uh, expenditure. And so these are the difficulties that governments had to deal with. I'm sure your countries also had these discussions. And so financing social protection is a priority, but it has not always translated into services. I'm sure in your countries that have better school, infrastructure, health, and service provision is scaled up. But for countries such as ours, the mere fact of being able to build a school is already an investment in social protection because it is basic. It is where it's like it was happening in the 1940s and 1950s elsewhere. We have moved back tremendously on account of the damage to democracy and the country. The thing is that for countries such as ours, we must try to maintain our heads above water and try to make these adjustments reasonable. What is social protection for a country that has 6 million people living in extreme poverty? Or what is social protection for another country that only has 1 million people living in extreme poverty? Well, we should see this in perspective because that also will affect the reconsideration of these concepts. And so, according to the category and the dimension related to what is really going on. And in other words, we can put salt in a wound or put your finger in an injury, but we're trying to put out fires. And this is the reality for a country such as Honduras. It's important how we analyze social protection and that the separation of the contributory and non-contributory systems, we must understand that aside from the coverage and social records, it is dramatic, the level of poverty and vulnerability that we're experiencing, and we need solutions made tailored to our needs. And in some parts of the region, we're even seeing these things happening once again. So it is important to put our finger on the investment and prioritizing how to find the money. But aside from that, how can we ensure that each dollar or currency that we use in our countries counts and that is used to reduce poverty and ensuring the well-being of our population? Thank you. Well, thank you very much, Secretary, and thank you for highlighting the heterogeneity of the challenges and social protection in the region, and also for making this difference between social expenditure and social investment. This is really an expenditure investing in eradicating poverty in order to have more democratic societies, better cohesion societies with less levels of violence and more productive people. So at the end of the day, what we're doing is investing in people. And so now I will hand over to Noel Perez, and that I'm told that he must leave after his presentation. So I thank you once again for being here today. Thank you, Mariana. And well, I too would like to thank you for the order of the presentation because after what Alberto and the secretary has said, it's as though now I've been left with the ball in the small area. So, well, But I would like to, I've heard very interesting things here, so I too will reflect something that Alberto and the Secretary have already said. And the first is this, the relevance of the context and how the context conditions, as Alberto said. And I think that this is important, but to understand the dimension of the problem and possible ways of addressing this to find solutions. I will quickly present the regional fiscal context, which reflects what the Secretary has just said. Our region, in general, spends more than its income, as the Secretary said, and this means that the countries tend to resort to fiscal deficit and over time become higher levels of debt. And you say that this began in 2010, but we have records that go back to 1950, and the gap that you see between income and expenditure is recurrent. And it does happen historically in the region. And the debt cycles are also very relevant. And then this shows just the last 24 years. But in general, we do know that although the situation is heterogeneous and depends on the countries, but in general, there's a major restriction on the fiscal side. Now, this is important because we must understand that within the fiscal context, there is an additional context which is between the expenditure context, the different pressures for resources in different parts of public activity. And I would like to highlight the one on the left, the payment of interest. In the region from 2012 through 2022, interest payments on the debt has increased by almost 1 percentage point of GDP. And if we recall Alberto's presentation, this 1% would be sufficient to have financed practically or reaching the poverty line. So what does this mean? Well, that these resources that are going out to pay for that greater debt that we saw on the previous slide, it takes space away to finance other spending. We were talking about social expenditure, but on the right, I would like to show you 4 main areas for development of countries. And if we compare the interest payments with what is spent at the level of central government in education and health and social protection and investment, then we have the rest. We're paying in interest 60% of what is paid or spent in education, we're paying it out in interest, 64% of what is spent in health, 54% of what is spent in social protection, and 185% of what is spent in public investment. And so here too, something to take into account, was said by the Secretary, public investment with climate change and the need for adaptation and mitigation of climate change and the greater incidence and strength of these natural disasters is an additional pressure that will continue to rise. And so it is very important. Many of you need to work or sometimes deal with ministries of finance. I'm sure you've heard Alberto refer to but since I'm from Mexico. In Mexico, we talk about the tortilla, but not the cake. But well, if you try to cover or like a little blanket, and if you try to cover your feet, you're leaving bare your neck. And so, well, it is important to think it in this context and how you're conditioned by this. Now, here I'm going to put to you something very briefly. This is no secret. Yesterday was talk of demographic transition, and in this context and epidemiological context in the region, what we do know is according to the population of our countries are aging, and so there's going to be much greater demand for resources, for pensions, and for health. 2 examples.
So we can think that there are some countries that have the population that's a ratio for the whole population, but nobody is saved. This is a reality that all the countries will face. And it is very important, therefore, to think what we have to do. If I stop here my presentation, I think we better close down, shut down, because this is in the context what we should think of in order to give a viability and to put at the core of discussion the sustainability of the social protection schemes. Here I show a short listing that there is a lot of work behind the different fiscal outlooks that we have published in the recent years. And the ECLAC is trying to position here its sustainability To provide sustainability to these higher requirements of expenditure that we have in the region is not economic and socially or politically viable, that in order to provide sustainability, we have to reduce the public expenditure. And therefore, we have to turn it the other way around. And this means widening the fiscal space, strengthening the fiscal resources, and to give more progressivity. And in the previous session, we were discussing about the fiscal tax evasion, and we calculate that in 2018, this represents $300,000 million. And then this is the number of resources that is impressive, and this implies an agenda to reinforce the mechanisms for information reporting that the tax-related authorities have, as well as the finance ministries, in order to reduce these levels of evasion. That was a very interesting case in Mexico during the pandemics, when people were when we were able to collect 1.5% of the GDP, and this provided enough resources to face the pandemic. Another important topic that in a certain way has already been commented are the tax reliefs and the differentiated treatments within the tax system. In the region, they represent around 3.7% of the GDP on average. If we think that the uh, benefit is accorded to a person or a corporate, is like an indirect expense, and this 3.7% of the GDP would imply that our countries are spending 19% more of their budget. It's very important to analyze these resources because in here we have some leeway for those who do know how to maintain this as a progressivity mechanism or to attract the investment and to make them work well and to change those that are not working. Another issue that was raised by the secretary, we should think about the new taxes or not, but let's think just about one tax, the income tax, and the most important gap that we have between Latin America and the OECD is we are collecting 2.1% of the GDP in OECD countries, 8.3% of the GDP. And therefore, there are people with a high income level and a lot of illusion, tax illusion in the system. Obviously, we are a region with a high degree of informality, but we have a very important task on which we have to work in the region. Then there is another issue related to a comment from the previous panel. The um, the taxes to inheritance and to uh, the net worth and the property and the one for properties. And here we have important gaps for these taxes. Another issue now, the countries of non-renewable natural resources, we should have the fiscal frameworks for these areas of activity that can be more progressive. We have had already some experiences in the region, but I think that it's also a very important area. We should consider also the environmental taxes and public health related taxes. There is a problem of engagement, and some countries are moving ahead in terms of health mechanisms, but we have to think that from the point of view of social protection. Now, as far as the financing is concerned, we should consider some financing instrument that should give a better condition the sustainable bonds related to the SDGs, to the climate change, allowing to go out and to have access to these resources in under better conditions. And this is connected now to the platform. One of the most important topics globally and in the region is digitalization of the economy. tax systems are not yet in full capacity to tax the digital economy. And here there is an initiative we have been working from 2020 to 2023 that has been fostered by Chile, Mexico, and Brazil in order to attract the ministries of finances in the region to have a space for exchange and providing the region with a better wage from the point of view of tax collection. Well, we should also consider this from the point of view of expenditure. It has been mentioned here, as the secretary said, that this dollar, this peso should go directly to the beneficiaries and it should have an effect. This means that there is a lot of work to do. This is related to the institutional framework and to improve the allocation of resources and a better strategy for the um, public expenditure and fostering the investment. I conclude here and I thank you for your time.
Muchas
Thank you, Noel. You are excused now if you have to go. Thank you. In this context of fiscal restrictions, the solution is not reducing the expenditure, but widening the fiscal space, reducing the levels of inflation, reducing the tax reliefs, and to increase the income tax. And this made me reminded me something we covered this morning, that this is a subset of the political space, important of having the agreements to say this is what we need. We need to further invest in people. Before giving the floor to Noelia, I should remind you that you need to fill out surveys you have on your desks. And I would also remind the 80 people we have connected online to fill out this survey because this is a very good input to improve the conferences in the future. No idea, you have the floor now. We need to download the presentation.
gracias, gracias.
Thank you. It's very difficult to be the last one to comment and to take the floor. I will try to be brief. The advantage is that you have said it all, and I would like to highlight two topics that have been raised here by the panelists. And the first issue is the concept of sustainability that Alberto referred to, this very wide concept that should include the sustainability of the social protection systems, including the coverage, the sufficient the benefits, and the financial sustainability so that the systems are able to survive in the future. There is a reflection that I do. It is important to have another dimension, which is the political one, the political economy, because in many of our countries, sometimes many changes are implemented in the pension system or in the social protection schemes that are against this financial sustainability or the sufficiency of pensions. An example is the Peruvian case that we had during the pandemic. The withdrawals were authorized from the saving accounts of people as an alternative of liquidity vis-a-vis the pandemic. And the government, before rather than giving these bonds or support, mechanisms, and people were invited to use this money that should be reserved for the old age. So far, we have 7 withdrawals that were done, and this is equivalent to 10 points of the GDP. The pension fund went from 32% in 2019 to 21% at the end of 2022. And this is serious and important because it will have some fiscal pressures. Many of the people who withdrew money for different regions are going to require the minimum pensions or non-contributive pensions. And this is an example of how sensitive our system of social pensions are when these political changes take place. And this happens particularly in countries with systems that do not have a comprehensive social protection system or the condition cash transfers. Um, the rural areas and deficits in the institutional framework. As the Secretary of Honduras was saying, and the difficult economic situation they are going through. And in this regard, it is difficult to say, well, let's just spend more in the social protection system. And I think that this other aspect is also very important to be taken into account to change the paradigm towards the idea of social investment that will have a payback and in the short and the long term. In the case of the non-contributive pensions, there are many documents, many papers. I am member of the academia and I read many papers, and they show the effects not only for reducing the poverty but connected to the physical health of the older citizens. They go to the public services, they treat the existing diseases that are impacting the mental health and nutrition.
entre otros. Entonces,
And therefore, it is profitable to invest in this kind of non-contributive pensions. Now I would like to highlight the impact of the non-contributive pensions in equality terms. This is one of the most important contributions that these non-contributive systems are undergoing. And I think they should help us in order to advocate for these reforms that increase the investment in such schemes. On one hand, we have the contributive systems, and there is no major impact in reducing the inequality. It is sad that you cannot see the table now, but for the Peruvian case, I conducted a very uh, clear cut analysis. I used the surveys from 2004 to 2017. If you go to slide number 4, you will see there we have the household surveys and we have the Gini index and the pensions of the older population. You can see the line below showing the index of Gini index for the national system of pension funds, the people who receive public pension. And the line that is growing is the Gini index for the population receiving these private pension funds, that is to say, individual income. And this is a slightly growing trend in inequality terms.
que provienen de los mercados laborales, ¿no? Pero de alguna manera lo que somehow it seems to me that there's no big change in inequality and contributory systems. And This brings me to my next analysis, the impact of non-contributory pensions that were implemented in 2011. This is focusing the elderly in under extreme poverty, and that's pretty low, about $35 a month. The impact on inequality. On the left, we see Gini by gender, and on the right, per place of residence. We are able to notice that these contributory pensions are indeed having a positive impact, and they are reducing inequality amongst these older persons, and especially among women. On the right, the impact is even greater in rural areas. In Peru, this is mainly oriented towards people in these areas. This is an important message that helps us see what's happening with these pensions. Now, what are the challenges faced by many of the countries? I will use Peru as an example. We still see these non-contributory pensions as a social program. This has not reached the programs of Chile with the universal pension. We still haven't gotten to that point. Coverage is on the rise, but it's still limited. At 2011, only 2 of every 10 older persons receives a non-contributory pension. And it's interesting that this coverage has already reached the contributory system as well. But as I said, the benefit is too low. $35 a month is what is paid. And we know that the purchase capability has gone down. And we know that this can be sustained in time. We're now spending about 0.314 of GDP. And the coverage is still limited though. But interesting data. If we compare this spending or this investment in non-contributory pensions with what we spend in the contributory system that I said covers about the same number of persons. The spending here is 1/10. So it seems then to be more efficient. But as I said, we still don't have a strong institutionality to increase these pensions. It's difficult to go towards universality. There is a bill to reform our pension system that is being debated in Congress. The executive branch wants to extend this pension, but only to a small group of persons, those below a certain level. So there are still challenges in understanding what's happening here and what are the challenges to reach universality. Let me say that the investment that is needed, as Alberto said, we don't need that much in Peru in order to reach universality. Universality. We are here with these figures. Just to give you an idea, reaching 60% coverage of older persons who are poorer, we would need an additional investment of 0.6 of GDP by 2030 and 1.1% in 2035. This would then cover all older persons with a non-contributory pension, and they would leave extreme poverty. So zero point 0.6 by 2030 and to 1 point by 35 doesn't seem to be that high a target for such great returns, that is getting these persons out of extreme poverty. Thank you. Thank you, Noelia. And I'm sorry about the PowerPoint, but yes, you indeed did brought us an excellent presentation, and you were punctual. It's good to hear that this is a pretty efficient investment. It doesn't require 1% of GDP, and the impact in poverty and decreasing inequality is tremendous. Thank you for your comments. We are behind schedule. But I still, in spite of the late hour, I would open up for brief comments from the audience. Thank you. I'd like to bring in a reflection related to the need for social protection policies that can anticipate events. And that's the main lesson we got from the pandemic. It's not enough to adapt. What we require is information and knowledge in as much as possible in order to foresee the trends, processes that are already on the go, and thus design policies before the issue occurs. We usually react, and thus we improvise. So this foresight in social protection is a basic. We talk about aging. Well, we know what it involves, what it entails. So how to better prepare? Foresight. We require a different way of doing things, not just getting rid of the problems, but rather creating the necessary public infrastructure so as not to be caught off guard. Secondly, in taking a look at the title of this seminar, we have to be candid and ask ourselves, did we really learn that much after the pandemic? Are we really drawing the conclusions on what happened, or are we seeing it as a fright that has already stayed in the past? But I would ask, are we now better prepared for the next crisis? Or are we saying we did what we could, some better than others, but did we really learn the necessary lessons? Because we all know about the structural weaknesses that were made evident. But ask, do we have a roadmap to overcome these structural weaknesses, or are we hoping that it won't happen again? Since we heard about the institutionality and social policies, we should have certain level of foresight to build better conditions to face this. We've talked about the diversification of risk structure, and I would say the intensity as well should be seen. I wanted to leave this thought amongst all of us because otherwise we will be full of old synergies, and when they happen again, we would realize that we all stumble on the same rock. So we need to be honest, to reflect, and pose the questions. What did we really and truly learn from the pandemic? Thank you, Pablo. We will only give the floor to three persons. Juliana, Alexandra, and Luz. And by the way, the book was written by Maglev, It is entitled The Austerity History of Dangerous Times. It has to do with the economic policies and the destruction of the social mesh. Have in mind the Second War. Many authors are doing a parallel with this, the growth of fascism and authoritarian ideas are on the rise in the world, just as in 2030 there was social frustration throughout the world. I wanted to bring this because talking to people who are in charge of political of economic policies and the new consensus on new pacts means that we have to have a common sense in talking about austerity as a narrowing public spending in social goals. It's probably not the best way to go about this. Many countries in the region have gotten back to normality, but having austerity in mind. But we must have also scientific criteria in mind. Science also is involved in social and economic thought. We have to bring this all together. That's a challenge. It's clear that the fiscal responsibility means using all the variables, including income. It's not true that lack of austerity is what we should tackle now. No, we're exchanging public debt for social debt, and this social debt is going to have to be paid through authoritarian regimes and drug trafficking, through many things that can happen. But how to get a common language recognizing that that is so, and having common denominators in the world of finance and of social protection. Sometimes we're talking about very small shares of GDP that should be invested. We're not talking about 10 points that are needed. No, we heard about one single point that can make a huge difference. And these are urgent conversations that must be posed. My country is now promoting a law for tax balance, and they say tax justice is fair and needed. To quote an economist, Thomas Piketty, in his last book, talks about this. He says that this tremendous inequality will sooner or later make states adopting decisions to redistribute wealth. And austerity is really a trap. And it's not true. Capitalism, in its neoliberalism, decided to sell to the governments that idea so as to overcome deficits. But in the way, this passes a high bill, as in Chile with the outbreak. But after 2030, when we see whether SDGs have been met, then we'll go back to the fact that the states will have to adopt sovereign decision in looking at the big fortunes and redistribute the resources, especially the accrued wealth that is tremendous. And by the way, we didn't learn anything, Pablo, from the pandemic. I think that's one of the conclusions. Michael says so in a treaty on political philosophy that has just been published. Thank you.
I would like to second my comment of yesterday. A lot of what we're talking, the virtuous cycle that could exist between social investment and a responsible, sustainable fiscal policy that is far more progressive, has to do with merit. Who merits social protection and who receives social protection? Because that also informs debates on fiscal policy, on whether there is fiscal space to invest in social protection, or if it is only social protection for the poor and those that need protection. And so, therefore, the mechanisms to focus on poverty and the issue of merit has to do with the social contract and the fiscal compact that we're talking about yesterday, because ultimately, if I'm a citizen where I consider that the fiscal policy and that steals the taxes, etc., I do not want to pay tax. And that is a matter that ends up being very negative for the narrative surrounding poverty, the narrative surrounding who should receive that social protection, and so therefore also investment. And I like what Alberta was proposing regarding the financial sustainability. And one element of that and the adequacy of the benefit, because this also has to do with how much we invest and what value we give to what we're investing in. And if it is a social investment for everyone, we're all invested in that being a better investment. And I agree with Pablo, and as I said this yesterday, in that I think that there are still a lot of things that we've not yet learned and that we could have improved in this sense. And to conclude, be it a blanket or an said or a pie, but ultimately it is a matter of priority setting. Because resources, aside from being scarce, they are there. So this has to do with narratives, with what we consider to be important or not to society. Well, I merely wanted to make a comment, seeing the glass half full, and thinking that, in fact, we have not moved as fast as we should have, but we have moved, and I believe that things have moved, albeit slowly. And in fact, I think that what you have mentioned regarding social protection, participatory social protection, is already been included in some countries. And in fact, they're already designing programs that have specific models to address emergencies or to be invested vertically or horizontally in times of shocks, and designing contingent forms of investment in order to cover future eventualities. And this has been seen in countries such as Costa Rica and Colombia. And so I think that little by little, maybe as quickly as we would like, but things are moving. And the social records is also contributing to that. For example, the establishment of the geovisors or the mechanisms to cross-match information from on natural disasters, and the social records helps anticipate the shocks and mitigate the impact. And we have a concrete example in the Dominican Republic, in Chile itself, and also Colombia and Ecuador. So I think that progress is being made. And of course, coverage is insufficient. The sufficiency or adequacy of most programs is not the best, but I believe that the target should be continue to work towards social protection that is far more robust in the long term. Thank you. Well, thank you all for your comments. I do not know if the main panelist, presenter, or the commentators would like to answer any of these comments. Well, no. In that case, I will take the floor. Very interesting debate, and Pablo's questions, Juliana, Alessandra, and of course Ruth. I would like to pick up on one theme mentioned by Minister Carona, Noelia, and I would like to say that we speak here saying social protection is social investment, and we are convinced of this. But what is the example I'd like to share? In the world of economy, when you speak of investment, we're talking of investment, and you set it aside from current expenditure and you link it to development. When you speak of investment in human capital, we economists speak like that. You link investment in people, investment in education, and it is linked to development. Investment in health A healthy population is linked to development. So the question about social protection in social investment or non-contributory investment, which eradicates poverty, reducing inequality, there is no consensus. There is no consensus. I'm not saying in the room, no. There is no consensus on social investment. It is social expenditure. It is a transfer. It, so part of the narrative that should be constructed to have more supporters, people who are not in this room but also affect the decisions, is this being convinced that as we are, that social investment is an investment, but the non-contributory one that directly eradicates poverty and helps and face inequalities, we call social investment, and we should have that narrative of how to sustain it as a social investment. Because if it is seen as an expenditure and a transfer, it always will be considered as minimum and irrelevant to development. And that is why we have spoken of having a standard in expenditure in non-contributory social expenditure. You see, he corrects me. This is part of my past. Yes, investment, well, but you need to have a transition, but a standard of social investment, non-contributory, is absolutely necessary, not only on account of the signals that you're giving, but also you link it to development strategies and even an inclusive social development. Thank you. Thank you very much, Alberto. Do not turn your mic off because I will now hand over to you for the final words. And with this, I end panel 8 and I hand over to Alberto for the final comments on the seminar. Very well. I was given 10 minutes and I will keep to that, no more than that. Well, my dear authorities in person, representatives of the entire region or a greater part of the region, academics, officers of international agencies, we've had a very rich discussion on different areas related to public policy for inclusive social investment. We've come to the end of this seminar, interregional. I've not yet learned the title, but it has to do with the future of social investment. And we have organized together with German cooperation, not in person, but online. And basically, German cooperation has been essential not only for this seminar. This seminar is one of the closing events of a 3-year project where we'll be able to at least reach 7, 8 countries online, in person, and with some of the authorities here in person. And German cooperation has been essential in helping us to overcome the consequences of the Latin America and the Caribbean of the COVID-19 pandemic. I think that this has been an opportunity to learn and share, and that we consider to be very relevant in order to grow in the design and implementation of public policies for social investment. We've been able to identify strategic, friendly, and sustainable policies and strategies. Easy to say, but not so easy when you're working in public policy. And basically, to move ahead in the strengthening of the social protection systems that we at ECLAC call them with 4 characteristics: universal, integral, sustainable, and resilient, within the framework of a state of well-being that's in the process of construction in the region. And we have reflected together on the future of social protection in a context of crisis, an unprecedented crisis, context where we have explored various paths towards the construction of social protection systems, and that when we speak of universal, we say it in United Nations without leaving anyone behind. We say that they are integral because basically what we want is to address the various demands, but with concrete offers. And we think that they're sustainable. These are commitments not with a generation, but this one and following ones. And we're always resilient because basically we take responsibility. The pandemic checkmated us all and put us in a situation where we had to respond, as we were seeing yesterday morning. Among other things, we've also said it, that this context of moving ahead with the social protection system with these characteristics, of course, in our view, occurs in a context where we here have defined it as a crisis of development in the region. We have been explicit in saying that we are in a process of crisis development or rather, development crisis in the region. And with issues that have to do with the low growth traps, high inequality, institutional capacities with many deficits, and in fact, in our view, that these are things that condition the development of social protection. So we have shared experiences and best practices, recognizing the various realities and needs of each country, but also identifying points in common, as Pablo was saying. We've also renewed our commitment to positioning our development strategies at the core, and we say that this must be inclusive and and strategic for sustainable development. We believe that inclusive development, it has to do with productivity, sustainability of the environment, with the issues are related to economic development. And we understand that investing in social protection is investing in that sort of inclusive social protection. And we highlight the role of strengthening policies and strategies that speed up the significant reduction of poverty and social inequalities, maintaining the validity of a universal approach to social protection as the articulate or connecting view, and the centrality in today wanting to protect social investment and social cohesion. We've highlighted the relevant experience in expanding the coverage of these contributory pension systems, and also as an example of an opportunity in a particular sector, an age group of the population to move ahead with institutional and financial viability towards universality of the coverage. And we're hoping that this example may be added to benefits that are urgent for the region to allow us to overcome appropriate levels of protection of the early childhood, and eradication of child labor, um, unemployment benefits and contributory pensions, and policies for labor inclusion and integral care policies. Social protection is a universe and very large. And especially, it has been very enriching to have heard the experiences and lessons learned from each one of you, the special experience that brought by countries of the region in such a solution, and the construction of cross-cutting agreements in order to promote policies for social protection, but that are linked to social development policies that are inclusive. Since the extension of coverage for informal workers, as we're talking about today, the strengthening pension systems and the use of technology are an issue for social protection, a key piece in the puzzle in the region. I would like to express my sincere thanks to each one of you for your active participation and the commitment shown in the last 2 days in this common cause. And thank each and every one of you who have traveled, and especially those in presence coming from outside Chile, and wishing you all a very good return home, those who leave today or tomorrow. And likewise, I would like to invite you to continue to collaborate in a more productive future, inclusive and sustainable. And I would also like to take a moment to express our deep, deep gratitude to German cooperation. I said it, but I'm repeating it. This is a 3-year project, and they have told us that it will last another 3 years more. So we will continue to be able to work in the region along these lines. And we thank Manfred Henze for the program, and Fran Kleiner, who has substantively helped us these years. and also departing from the protocol because this is usually not done, but I will do it. I'd like to congratulate the work of my team in the Division of Social Development. You have seen them all. They've been moderators, they've spoken, they've been in publications outside. The entire division has been behind this. But I will leave the protocol and ask a big round of applause here for Claudia Robles. Of course, for Claudia, she told me not to do this, but I did it. Claudia, the last 3 years, has been really been into everything in this project. And in fact, the seminar looks very much like the regional seminars for social development that we do every year. And the team that she works with, Isabel Jaca, Nilson Figueroa, Juan Vila, over there at the back. And also, I'd like to thank the tremendous support received from Nancy Rivas, who's hiding there behind the computer, seeing the logistics and all the traveling of all of you who are here, and of course other people like Santo Garcia, Daniel Neos, Maria Pali, Consuelo Farias, who have allowed all of this. And also the moderators, the commentators, and everyone in the division. This seminar for us marks the beginning of a new stage in terms of the various efforts to build social protection systems. And right now, I invite you from the 25th through 27th of June to the fourth seminar of social development, and we're going to focus it on inequality. Education inequality, health inequality, labor inclusion inequality, pensions inequality, because we are sure that inequality is inefficient. And in that context of being inefficient, not only socially, but for productivity, for development, and to unite other people who are not in this room so that they may think of investing in this is important. And also, we will be in the preparatory work, Minister, yes, at the regional conference on social development for Latin America and the Caribbean, and in particular, as I was saying today, the second World Summit for Sustainable Development of the UN in 2025 is a very, very important milestone so that the region, with the reading of the region, should put up themes in this sphere, equality and social protection. I would like to close by saying we've talked about the future of social protection in the last 2 days. And at least now we have spoken of different dimensions. There is a tremendous document that Claudia has edited, and we think it's there. There should be a link. What do we understand by the future of social protection? But among other dimensions, there's one that I have highlighted. There's one that I have highlighted that, in my view, is essential for the future of that social protection, and that has to do with the agreements, what we call the social fiscal compacts that allow consolidating the social protection systems to effectively move ahead in the eradication of poverty and reduce inequality.
And when we speak of social pacts, it seems to be something far away from reality. At the end of the day, all the countries in the region do have a social pact. They have agreed on what kind of protection they generate, the protection of income, and they agree upon that. And that is what they do have in their social protection system. So, in a world that is changing very quickly with transformations, as we have said, from the point of view of the environment, social point of view, technological point of view, it makes that social protection also changes, that it transforms itself. And within this context, within this transformation, and assuming this world that is evolving, basically, it is highly important for us to put at the core of the debate and those changes the ideas that for the future of that social protection we will need those agreements, political, economical, social agreements, so that the social protection can have another tier in the ranking of priorities. So far, this is quite agreed, but we need to convince other people, other agencies that this is the case because if we continue to do more of the same, we already know the history, the gaps will do nothing but widening. And the fiscal and social agreements do not just facilitate the financial sustainability, but they put this topic of the future of social protection as a priority. So, for political, social, economic priorities of the countries to move ahead in the strategies of development, the strategies of inclusive social development. That is the level of narrative, the level of narrative of what we are building. And on our opinion, this is very important to move ahead, not only agreeing upon reform, but agreeing upon this transformation of the social protection that is required and that is occurring in the world very quickly. Moving ahead in these new social agreements together with the fiscal agreements and developing the abilities to summon those who are convinced and to engage in a debate with those who are not yet convinced. And I hope that we are all convinced in this room and with the people who are online and to make an effort to deploy this effort to move the frontiers of the social protection. And this is the calling we do to build these solid strategies for the inclusive social protection in the region. We'll greet all the interpreters because normally I say translators, but they are interpreters, and we thank them for staying so late. And I would like to thank the conference unit, ECLAC, and so happily we have been able to carry out this international seminar. Thank you once again, and hope to see you soon in the regional seminar of social development. Thank you very much.